Good evening, everyone. I hope I'm audible. So let me open the link. So tasty. Hello, everyone. Good evening. I hope I'm audible. Just let me check the audio video first, then we'll continue. Good evening. Good evening. Am I audible? Please tell me. Hello. Hello. So just checking for the audio video. Once it's perfect, we'll start off. I hope no disturbances. Okay, good evening, everyone. So, welcome to today's biochemistry session. So, where I'm going to discuss all the previous year topics. So, basically, previous year topics, the material is curated in such a way. I'm going to cover all the important key concepts of biochemistry, which has asked in last 3 to 4 years of this thing. Okay, because biochemistry is such a subject where you're going to get around 15 questions here. Around how many? 15 to 17 questions. Okay. So when we are getting 15 to 17 questions, out of 15 to 17 questions, you can get almost everything correct. Okay. So just based on a few basic concepts which are to be learned. Okay. So it's gonna be about a few hours. Okay. About 3 to 4 hours per se. Okay. So in which I will cover all the important key concepts so that it won't be a problem for anybody. Okay. So all right. So welcome to today's session of biochemistry, where we are going to start off with the most important chapter. Without this, there is no possibility of having a question paper. 99% of the times there will be question based out of the topic of vitamins. Vitamins is a very important concept. So let's try to understand that. Okay. All right. So you're absolutely right. The fat soluble vitamins are vitamin A, vitamin D, vitamin E, and vitamin K. Okay. When we are speaking of vitamin A, D, E, K, there are few important key concepts which can be asked related to vitamin A. So vitamin A deficiency leads to a disease. What is that? That is only called as a xerophthalmia. What is that? Xerophthalmia. So xerophthalmia is a condition where dryness of the eyes will be there, and there is something called as nyctalopia. So this nyctalopia, what is nyctalopia, my dear students? It's a night blindness. But before I jump into any other concept, let me talk to you people about vitamin A's few important concepts. What are those few important concepts? So vitamin A related, what are the other key points which can be asked? Vitamin A is a type of fat soluble vitamin. All of you know vitamin A is responsible for vision. Vitamin A is responsible for vision. So this vision occurs through which cycle? So this vision occurs through something called as Wald's visual cycle. Wald's visual cycle. Okay. So there might be direct question which can be asked to you people. Wald's visual cycle is responsible for what? For what? So that's the Wald's visual cycle is responsible for vision. So the Wald's visual cycle, the most important component of this one is called as, with the help of a substance called as a rhodopsin. What is the name of the substance? Rhodopsin. Rhodopsin is the chemical which is a type of conjugate protein. It is a conjugate protein which is made out of retinol and also one more protein called as opsin. Okay, retinol and opsin together they form a rhodopsin. This rhodopsin plays a role in the Wald's visual cycle. This is the important key concept which can be asked to you people. Okay, so once you know about Wald's visual cycle, most important concept is so that's vitamin A plays a role. The role is it also works as an antioxidant. Oxidant, what is that? Antioxidant is responsible for vision, and also it is responsible for keratin metabolism. Okay, so when we are speaking of keratin metabolism will occur with the help of vitamin A. Vitamin A regulates the genes which are responsible for keratin metabolism. Okay, so for example, in the vitamin A deficiency, every time they had asked a question related to bite out spots are seen with which vitamin deficiency? Vitamin A deficiency. So this is in which stage? Okay, so this stage is called as X1b. What is it called as? X1b stage. Okay, so this is an important key point which is the time where you can find the bite out spot. This is in the stage of X1b. X stands for what? X stands for not your ex-girlfriend or boyfriend. X stands for what? X stands for, most importantly, that is X stands for xerosis of the eyes. Okay, so all the vitamin A starts with what is that? Xerosis. So bite out spot is seen in conjunctiva, bite out spot is seen on conjunctiva. Very, very important. And one more important aspect is not just XB, X1b, dear, X1b. Okay, so it is seen on conjunctiva. It is made out of what? This is also a previously asked question. So this is made out of what? This is made out of keratin. This is made out of keratin. Okay, so these are the key concepts which will be asked related to vitamin A. So vitamin A is a vitamin responsible for mucosal healing. One more use. What is mucosal healing? It is an antioxidant. And also it is responsible for the keratin metabolism. Okay, so once we understood about the vitamin A, let's go to the next vitamin, which is that vitamin. So vitamin D. Vitamin D again is a very important. Vitamin D deficiency in the children leads to a disease called as rickets. It leads to a disease called as rickets. Okay, in the adults it will lead to osteomalacia. What is that? Osteomalacia. Okay, so osteomalacia is seen in adults. While we are speaking of vitamin D deficiency in the children will lead to a disease called as rickets. Okay, so it's in the adults. Now let's talk about these two diseases very quickly. Important key points of these two diseases. So when we are speaking of vitamin D synthesis starts from the skin. Okay, so vitamin D occurs from the skin. Okay, starts from the synthesis of the vitamin D occurs from the skin. Then it will next stage is in the liver. Okay, in the liver which synthesized vitamin D2 is synthesized, and this D2 will get converted into vitamin D3, that is only 1,25 dihydroxy cholecalciferol. Okay, so this is the most important vitamin, which is an active vitamin, which is an active form of vitamin D3. So vitamin D3 is also called as hormone, is also can be considered as a hormone. It also can be considered as a hormone, my dear students. Also can be considered as a hormone. So when we speak of vitamin D, so vitamin D deficiency in the children and adults, it lead to a disease in the children called as rickets. Okay, so related to rickets, there are some important questions. So automatically rickets is a vitamin D deficiency. In the vitamin D deficiency, my dear students, what are the clinical features we are going to encounter? The clinical features we are going to encounter is a very important point to be understood. So there is a delay of fontanelle closure. Delay of the fontanelle closure in the children. Okay, so in the head there are anterior fontanelle and posterior. So these fontanelles will close very slowly. Delay of fontanelle closure and delay of the fontanelle closure. And also there will be one more thing. What is that one more problem? That is only delay of delay of growth. Why? Because bone development requires calcium, calcium requires vitamin D3. Okay. Apart from the delay of growth, there might be deformities. There might be deformities. Deformities such as what? Deformities of the knee joint, such as varum, varum, okay, or there is a possibility of valgum. Okay, so what is this valgum and varum? Let's try to understand. Okay, so I will just give a just a simple schematic representation. So this is the leg of the baby. Okay, so this is a knee joint and a baby's foot. Okay, so this is the foot of the baby. Okay, so what has occurred? Let's see. So this is the knee joint. Then there is what? There is a genu varum. So in the genu varum, if you can see that the knee joint is going away from the center line. The knee joint is going away from the center line. Correct. You're absolutely correct, Jovita James. Genu varum and valgum. So this is your varum. Varum में क्या हो रहा है? दूर हो रहा है. Varum में what is happening? The joint is going away from the midline. Joint is going away from the midline. Okay. Then we have next concept, that is valgum. So valgum, what happens is very important to understand. So this is the leg of the baby, and this is a knee joint, and this is the foot. Okay, so if you can see what is occurred here, so the deformity, the knee joint is coming closer to the center, as if somebody put a gum and struck the knee joint. मतलब knee joint किस तरफ आ रहा है? Center line के पास आ रहा है. Knee joint is coming closer to the center line. Then we will call it as a genu valgum. So both the deformities are possible, genu varum and genu valgum. Okay, exactly, you're absolutely correct, MSP, sorry. Okay, now apart from the deformities, the most important question, what happens to serum calcium levels? Come on, everybody should give me an answer. Serum calcium levels in a patient with rickets. Okay, what happens to the serum calcium of a patient with rickets? Let me give you the option. Option A, decreased. Option B, increased. Option C, normal. Option D, all the above. Come on, everybody give me an answer. Come on, quickly tell me an answer for this question. What happens to the serum calcium in a patient with rickets? What happens to the patient with the rickets? So with respect to serum calcium level, I'm waiting for an answer from everyone. Come on, come on. बताइए बताइए. Take a guess, take a guess. Come on guys, quickly, I'm waiting for your response. Take a guess. If it's wrong, right, doesn't matter. So one of our students says it decreases. Any other answers? Decreases. अच्छा अच्छा, decreases. Okay, now listen to me very carefully, dear. The answer is the serum calcium will remain normal. Serum calcium will remain normal. Serum calcium will remain normal. So this is a previously asked question. Previously asked topic is rickets. Very, very important. The serum calcium level will remain normal. Serum calcium level remains normal. Serum calcium level remains normal. Okay. How? How is the question, right? How? Okay. Yes, normal. कैसा लगा मेरा मजाक? मजा आया? मजा आया? So how is the question? How is the question? Let's try to understand how does this work. Okay. So how does this work is a very, very easy to understand. So first of all, there is a decrease of vitamin D3. Decrease of vitamin D3. If there is a decrease of vitamin D3, immediately what happens? There is a decrease of serum calcium. Simple, decrease of serum calcium. So if there is a decrease of serum calcium, now your body will not keep quiet. Immediately as a response to this, remember serum calcium is a very sensitive parameter, as a response to the decrease of serum calcium level. So there will be what? There will be release of an hormone. The release of the hormone is called as the parathyroid hormone. Release of parathyroid. So the released parathyroid hormone will go to the bone and increase the, so it will increase the bone resorption. It will increase the bone resorption, means it is going to resorption of the bone. So resorption of the bone will lead to release of calcium, release of calcium release of so released calcium will cause the normal calcium level. Released serum calcium will lead to what? So calcium level becomes normal. Okay, remember, calcium level become normal. Why? Because the parathyroid hormone, whatever is released, that is going to bring the serum calcium to the normal level. So that is the point number one. And parathyroid hormone, whenever it is present, parathyroid hormone will cause the loss of parathyroid hormone, loss of phosphate ion. I'm really sorry, loss of phosphate ion. So loss of phosphate and calcium levels being normal is the scenario of your what? Is the scenario of your, exactly, is the scenario of your, of course, that is only rickets. And this was a previously asked question, बच्चों आप लोगों को ध्यान रखिएगा. This is a commonly asked question. What happens to serum, what is that? Calcium levels in the time of what? In the time of rickets. Is a very commonly asked question. Be very well prepared for it. Okay, so this is the story of your serum calcium with respect to this thing. And osteomalacia is a condition in which there will be pathological fractures. Pathological fracture means easy fracture of the bones, you can say. Means a injury, कोई भी ऐसा injury हो, a injury which is in such a way that which will not cause fracture to others. कोई दूसरों को fracture नहीं करवाएगा, it will not cause a fracture to others. But in this osteomalacia people, because of the weak bones, there will be fracture. मतलब normal small injury which does not cause a fracture in a healthy adult, but it will lead to the fracture. The same level of injury, if it causes the fracture to the others, we call it as a pathological fractures. Okay, so there will be also one more key point, my dear students, that is only called as looser zones. So looser zones are found on the X-ray, So they're a type of pseudo fractures. Okay, pseudo fracture. In orthopedics you learned. So the pseudo fractures are seen in osteomalacia. I hope you have understood so far about the vitamin D. Let's go to the next vitamin, that is only vitamin E. Vitamin E is a most potent antioxidant vitamin. Most potent antioxidant vitamin, but there is no clinically related. Theoretically speaking, deficiency can lead to infertility. ओके, अब मेरे ऊपर लड़ने, सर नो, ऐसा कैसे बोल दिया आपने, नो विटामिन ई. अरे भैया ध्यान से सुनो, मैं क्या बोला था. थियोरिटिकली स्पीकिंग, it will cause its deficiency cause infertility. We don't find any infertility cases with vitamin E deficiency that commonly. Okay, लड़ाई के लिए मत आ जाना. Sir, then how do you tell this? I'm quoting a textbook of biochemistry. I'm not making up things. I'm not speaking in nonsense. ठीक है, समझ आई बात, अर्थమైందా, understood, పనియత్న, समझ में आ गया. Now let's go to the next vitamin, vitamin K. So vitamin K is a very important vitamin. So vitamin K के बारे में जल्दी quickly देखो मैं कर क्या रहा हूँ. I'm covering the previous topic, I'm revising the previous year question, and meanwhile I'm giving you the clinical importance through which question can be asked. यहाँ पे हम लोग तीन चीजें कर रहे हैं. Previously पूछा गया टॉपिक, प्रीवियसली पूछा गया कॉन्सेप्ट, एंड आगे क्या क्वेश्चन पूछ सकते हैं एक प्रिडिक्टेड वे. Okay, now please understand vitamin E deficiency. Theoretically speaking, it causes infertility, but there is no such cases found clinically. But according to textbook, they say that it causes infertility, but it's not an absolutely certain thing. I hope you understood, Dr. Divas. समझ आई? Okay, let's go to the next one, vitamin K. Wow, this is very, very important, vitamin K. Vitamin K is a fat soluble vitamin. There is a synthetic there is a K1, K2, K3 vitamin forms. Okay, so Let's talk about vitamin K. Vitamin K अभी function तो बताया नहीं, मैं बताऊंगा. Okay, yes, you are absolutely right. Main function is coagulation, but you need to understand क्योंकि pharmacology के time पे आपको दिक्कत हो जाएगी कि to understand the mechanism. That's why vitamin K is called as phyloquinone. Phyloquinone. Okay, vitamin K2. Vitamin K2. Vitamin K2 is called as menoquinone. Menoquinone. Okay, let's go vitamin K3. Vitamin K3 is called as menadione. Okay, now here is the trap for you people. Menadione में डाई देखते हो, तुम्हारा दिमाग काम करेगा, it should be K2 ना भैया, ये डाई देखने के बाद भी ये K3 ही होता है. मेनाडायन में डाई देख के 2-3 में कंफ्यूज मत होइएगा. By looking at the dye in the dye in the menadione, don't think it as a K2, it's a K3 dear, it's a K3. Please don't get confused. Okay, so vitamin K का function क्या है? So vitamin K we have factor 2, factor 7, factor 9, factor 10. Okay, इसको ऐसा कर देते हैं 2, 7, 9, 10. So remember like this in a normal English numbers so that it will be easier for you. Okay, so they are in a stage called as precursor stage. They are in a stage called as a precursor stage. They are in a stage called as a precursor stage. They are in a stage called as precursor stage. Precursor means they are in a stage of making. Okay, so they're not synthesized yet, so they're still undergoing the synthesis. They're still undergoing the synthesis. Okay, so vitamin K is required. How vitamin K is required? They undergo a process called as gamma carboxylation. Okay, what is this gamma carboxylation? So gamma carboxylation is a process in which these clotting factors undergo the carboxylation in a gamma position. So what is this? For gamma carboxylation will occur. So for gamma carboxylation occurs, it is going to synthesize 2, 7, 9 and 10 in a inactive form. So we have a inactive 2, 7, 9, 10. So they will become active. कब active होगा? When there is a bleeding. So randomly, at randomly, they does not undergo activation. Rather than that, they will become active during bleeding. They'll become active during bleeding. During what? Bleeding. So during the scenario of bleeding, they get activated. So they are synthesized and waiting. Very if necessary, if there's a bleeding, they'll get activated. So 2, 7, 9, 10. For their synthesis, we require vitamin K. Vitamin K is required in a form called as vitamin K epoxide form. What is that? Epoxide form. So this vitamin K epoxide undergoes the reduction reaction. So vitamin K becomes reduced vitamin K. Reduced vitamin K. So this reduced vitamin K here will again come back into the epoxide form. Vitamin will come back once again into the epoxide form with the help of this complete reduction and oxidation requires an enzyme called as epoxidoreductase. What is the name of the enzyme? Epoxidoreductase. This complete reaction is done by epoxidoreductase. Epoxidoreductase. So vitamin K. K is a type of what? Coagulant. K is a type of coagulant. Which are the vitamin K dependent factor? 2, 7, 9, 10. Okay, it's a type of coagulant and source of the vitamin K. Source of the vitamin K, you have a lot of sources such as vegetables, okay, fish, egg, okay, meat. I agree, but most importantly, most important source is your body itself. Your body is going to synthesize the vitamin K. How it is going to synthesize the vitamin K? With the help of from somebody called as gut flora, the healthy bacteria which is residing in your intestine. The healthy bacteria which is residing in your intestine is the one which is going to help you what? Which is going to help you get the vitamin K. So vitamin K synthesis requires gut flora. So deficiency in the newborn, for every newborn we inject what is that? Intramuscular vitamin K. Intramuscular vitamin K. Intramuscular vitamin K is given for every newborn. Okay, every newborn. Vitamin K is given for every newborn. Every newborn receives intramuscular vitamin K. Okay, so why we should give a intramuscular vitamin K? Vitamin K, so very important. So very important. It is responsible for the production of 2, 7, 9, 10. Okay, so that is the story of your what is that vitamin K. Okay, but there are some more clinical important aspect. What is that clinical important? So it's given intramuscularly. So what is that? What is that we are going to give? So what is the dose we are going to give? So basically at the birth 1 mg is given. 1 mg is given, 1 mg of intramuscular. Okay, so intramuscular vitamin K is given for a term newborn. Okay, term newborn. So 1 mg is given for mandatorily for every newborn 1 mg is given. Okay, so once we understood about this, so let's continue to the next aspect. There is a key important concept. This epoxidoreductase is blocked by somebody. Warfarin. So warfarin is a drug which blocks the enzyme epoxidoreductase. That's the story of your fat soluble vitamins. ADEK. Vitamin K deficiency. Vitamin K deficiency leads to what? It leads to bleeding. Vitamin K deficiency leads to bleeding. Okay, vitamin K overdose, if it is there, you need to remember vitamin K overdose. If it is there, definitely the treatment will be warfarin, and vice versa is applicable. And here I'm guessing abhi tak pucha nahi gaya, so there might ask you one of the main important question: hypervitaminosis D. Hypervitaminosis D. So till now they haven't asked in last 2 years, but there is a probability they might ask you the question about hypervitaminosis D. Hypervitaminosis D, to stop the first excessive vitamin D is there. So if excessive vitamin D is there, increased vitamin D will lead to increase of serum calcium. Increased serum calcium will lead to deposition of calcium. Where? Calcium in the tissues. So which might lead to a permanent damage also. So here the treatment will be, there is important aspect, stop vitamin D. Okay, so next one, we also add steroids to this person. Corticosteroids are given. Okay, so this is the story of your, what is that? Story of your hypervitaminosis D. Okay, so LMWH, low molecular weight heparin. LMWH, low molecular weight heparin, is the something different, because low molecular weight heparin is an anticoagulant which works along with your antithrombin 3, which works with antithrombin 3 and also inhibits the intrinsic pathway. Mainly it is working through the antithrombin 3 is the indirect mechanism, and also it will inhibit factor 10A, that is the direct mechanism. I hope I have cleared your doubt or a confusion. Okay, so Dr. Divas. Okay, let's continue to the water soluble vitamin B1. So B1 deficiency leads to two diseases. One is beriberi, okay, and one more is yes, Wernicke's encephalopathy. So let's talk about the B1 diseases and clinical important concepts. Okay, क्योंकि यहाँ पे क्वेश्चन बहुत बहुत फेवरेट हो गया एग्जामिनर को nowadays. So let's not miss that question out. And these are a commonly made mistakes by the young clinicians these days. So let's not make that mistake and try to learn it. Right. So what is that? When we are speaking of vitamin B1, so vitamin B1. So B1 deficiency leads to a disorder called as Wernicke's encephalopathy. So when I'm talking about Wernicke's encephalopathy, I need you to understand. Okay. So warfarin ka uses. So you are going to learn pharmacology, but let me tell you people about the warfarin ka uses. Okay, as we speak about the warfarin is a type of anticoagulant which is in a normal terms called as a blood thinner. When we are giving warfarin, we monitor something called as INR, international normalized ratio. INR required for each disease is different here. Each disease is different. Okay, INR required for each disease is different. Okay, so it is used in the myocardial infarction patients, stroke patients, atrial fibrillation patients. Okay, any patient where there is a high probability of clot formation. Even in DVT we can consider these anticoagulants. But as the time passes, we have newer oral anticoagulants, so we are giving less importance to the warfarin and the clinical practice. Rather we go for a newer oral anticoagulants. अब इतना बात आ गया तो ध्यान से सुन लो. ओके, अब गोवा पे आते हैं. यू आर एब्सोल्युटली राइट. कार्सकोस परफेक्ट. गोवा एब्सोल्युटली करेक्ट. विल टॉक अबाउट गोवा. अब वारफेरिन के बारे में आ गया तो वारफेरिन को पूरा निपटा देते हैं. ठीक है, तो वारफेरिन को निपटाने के लिए पहले मुझे दो चीज आपको क्लियर कर देना है. Now listen to me, two things I need to clear. Okay, it is nothing related to Wernicke's encephalopathy बच्चों. Since we spoke about warfarin, उसको हाथों हाथ निपटा ही देते हैं with a story. Okay, so warfarin. Okay, so ये warfarin का स्टोरी बहुत इंटरेस्टिंग है. 1 मिनट लगेगा समझा देता हूँ. Okay, so even it is a possible MCQ. Believe me, it's a possible MCQ. Okay, कभी कभी एग्जामिनर पागल है, पूछ लेते हैं warfarin is named as warfarin Q. Okay, so let's try to understand that. Okay, so warfarin is a type of anticoagulant. So anticoagulant means it's a type of blood thinner. Okay, so warfarin का story क्या था? Warfarin derived from a chemicals called as coumarins. It's a chemical derivative of coumarin. So once upon a time, what happened few years before? So there was rat poison. So the rat poison used to contain coumarin. That rats, after consuming this coumarin containing poison, what happened? Rats used to die of internal bleeding. Okay, when rats used to die of internal bleeding, right? So somebody thought, so if rats are having bleeding and death, means there is a blood thinner. Okay, now this guy thought, okay, can I controllably use this drug? मतलब इसको थोड़ा controlled dose में करूँगा तो इंसान के अंदर भी, if I controllably use it in the human also, can I use it as a blood thinner? Because the animal started die of bleeding. Okay, so that's what he thought. So he went and told this idea to somebody called as Wisconsin Alumni Research Foundation. So this Wisconsin Alumni Research Foundation saw a potential in his idea and they said, we will fund the complete project, do the research. So the research was like this. So there was a rat poison which was causing the bleeding and death of the rats. Now these people thought that if controlledly used and isolate a chemical, right, this can be used as a blood thinner. That was the proposal. So completely, who funded the research? Wisconsin Alumni Research Foundation. Okay, and where these chemicals are derived from? They are derived from a chemicals called as coumarins. So that is why it has a warfarin name. W for Wisconsin, A for alumni, R for research, F for foundation, Wisconsin Alumni Research Foundation, Arin for coumarin. So ऐसा आया नाम वारफेरिन बच्चों. ठीक है, अब हो गया वारफेरिन. वारफेरिन is a teratogenic drug. It causes a fetal warfarin syndrome. Warfarin related all the important topics done. Let's go to the Wernicke's encephalopathy, which is seen with the B1 deficiency. So B1 is also called as thiamine. What is that? Thiamine. Okay. So when I'm speaking of Wernicke's encephalopathy is a condition. So what happens here is that, so Wernicke's encephalopathy is a condition in which the patient is going to have global confusion. Okay. So patient is going to have ophthalmoplegia. And ataxia. So these are the clinical features associated with what? These are the clinical features associated with Wernicke's encephalopathy. Okay, so Wernicke's encephalopathy is a disease in which what happens? Global confusion, ophthalmoplegia, and ataxia will be there. So that's why we get a mnemonic called as GOA for the clinical feature. Okay, so this is a central B1 deficiency. Central B1 deficiency means what is that? The B1 deficiency is majorly seen with the central nervous system. Okay, central B1 deficiency. Okay, now once we understood it's a GOA is a central B1 deficiency, it is seen in alcoholic patients, it's seen in alcoholic patients, and they can also have Korsakoff psychosis. Korsakoff psychosis. Korsakoff psychosis, a key point is that the patient develops confabulation. So, filling the lost memory after alcohol, though memory loss will be filled with the false memories. Okay, so that's only a Korsakoff psychosis. So, these are the clinical features associated with Wernicke's encephalopathy. Now, the next question is that a patient with a history of alcoholism, okay, which is about 20 years. Okay, now patient develops confusion and ataxia. Okay, his blood glucose, he also develops a hypoglycemia. Okay, hypoglycemia. Okay, so what is the treatment? How do you treat this person? So this is a very important question. Okay, so what is the problem? The options are: option A, dextrose 25%, dextrose 25%, 25% IV. Okay, option B, dextrose 25% plus normal saline. Okay, so just let me check once if audio video is clear for my satisfaction in the device. Yeah, everything is going good. Okay, all right. The option C, B1 followed by dextrose, Option D, dextrose followed by B1. Followed by that B1. Dextro B1 followed by that dextrose. Okay. Tell me the answer. I'll wait for your answer here. तो आप लोग आंसर दीजिएगा, then only we'll continue. Okay, let's see. So, some are saying C, some are saying D25. तो देना चाहिए D25. Okay. Others, please give me an answer. Give me an answer. So the answer, you always remember, you're absolutely correct here. Okay, you're absolutely correct. The answer is B1. Followed by that only you are supposed to give dextrose. Followed by that only you are supposed to give dextrose. B1 followed by that only you are supposed to give a dextrose. This is a very important possible MCQ which can be asked for you people. Very, very important one. Okay, so remember, so answer is B1. After that only you give the dextrose. Okay, so what if dextrose before B1 in chronic alcoholics? Okay, so this is a concept. So this is a previous year topic. So what if you give B1 in chronic alcohol? What if you give dextrose before B1 in chronic alcoholics? Okay, so basically you give a dextrose here. You give what is that? A dextrose. So dextrose will immediately enter into dextrose is basically isomer of glucose. So dextrose is an isomer of glucose. Which isomer? It's a D isomer of glucose, which is a optic isomer of glucose. Now this glucose immediately will get converted into pyruvate. Okay. Now what happens? So in a normal scenario, pyruvate will get converted into acetyl CoA. With the help of an enzyme called as pyruvate dehydrogenase. dehydrogenase. So this is the pathway of aerobic glycolysis. So this pyruvate dehydrogenase requires a vitamin, that is only vitamin B1. Okay, so in the chronic alcoholics, what is the problem? Chronic alcoholics, in the alcoholic patient, B1 is absent. If B1 is absent, pyruvate dehydrogenase is not working. So if pyruvate dehydrogenase is not working, there will be increased accumulation of pyruvate. All this accumulated pyruvate under the influence of an enzyme, lactate dehydrogenase, it will get converted into lactic acid. It will lead to acidosis. Lactic acidosis will occur. Remember that will lead to lactic acidosis if you don't correct your what? If you don't correct the blood B1 level. So first correct the B1, followed by the correction of B1. You are supposed to give the what? You are supposed to give the other substance. If you give without correction, if you give like that only, then it becomes a problem. Why? Because the person will land up into what is that? Lactic acidosis. The person will land up into what? Lactic acidosis. Okay, I hope this part is clear for you people. Okay, let me check your comments, then I'll continue. So this is a previously tested concept. So why does lactic acidosis can occur? Again, very important. Lactic acidosis, one of these causes is the increased amount of pyruvate availability for landing up into the lactic acidosis pathway. Okay, so once we understood about that, so because see, I'm checking your comments simultaneously, so I have to look at my phone. Okay, all right, once we understood about this, let's go to the next one. Vitamin B2. Vitamin B2. When I'm speaking of vitamin B2, right, B2 is also called as, what is it? Riboflavin. So riboflavin deficiency. Okay, riboflavin deficiency. The add wala disturbance is हमारा technical team will देख लेगा. Please देख क्या हो रहा है, इनको देख लो क्या चल रहा है. Okay, riboflavin is a flavinamide. So this deficiency leads to angular stomatitis, which is also called as chiliosis. Okay, chiliosis. What is that? Chiliosis. Okay, so this enzyme, this B2 is a coenzyme. B2 diagnosis, B2 deficiency of B2 diagnosis with the help of the important enzymes like glutathione reductase assay, and we can also check for RBC, red blood cell transcytolase. Red blood cell transcytolase can be tested here only. So for the diagnosis of B2 deficiency, because these two enzymes function will be impaired in the deficiency of B2. Vitamin B2 is also called as riboflavin. Let's go to the next one. That's only niacin, which is that nicotinic acid, are also called as niacin. All right. So this niacin deficiency, B3, niacin deficiency, all of you know the answer. What is the answer? Niacin deficiency leads to which disease? Boliye, sir. Boliye. Tell me, guys. Please tell me. Come on. B3 deficiency leads to what? So 3Ds, that's only called as pellagra. Which is also called as 3D disease. Diarrhea, dementia, dermatitis. These three are a very commonly asked question. तो इसको neglect नहीं करना चाहिए. Let me explain the vitamin B3 very clearly for you people. ये सारे के सारे जितने भी whatever I'm teaching, all the annotated PDF will be available to you people on our Telegram channel. So you do not have to worry about the notes. All the annotated PDF, I'll provide it at the end of the session. So you have vitamin B3. Vitamin B3 is also called as niacin. Okay, so when I'm speaking of niacin, okay, so niacin is the source of the niacin. It is produced within the body from an amino acid called as tryptophan. Okay, so death is a clinical feature of niacin deficiency. But usually, according to the textbook, it's called as a 3D disease. But death is added to the fourth one. You can call it as a 4D disease also. Okay, the source is what? The source is tryptophan. So tryptophan is an amino acid which is responsible for the production of B3. Okay, so if there is a decrease of tryptophan, if there is a decrease of tryptophan, it will automatically lead to decrease of niacin, decrease of niacin. You need to remember this very important key point. It also requires B6 with the help of B6. So with the help of B6. So please understand. Let me not put it here. बाद में देखोगे तो confuse हो जाओगे. So source, it is produced from the tryptophan by the help of B6. So vitamin B6 is required for the production of B3 बच्चों. Okay. ओके जो मेज बहुत ज्यादा मेज के ऊपर मेज डाइट के ऊपर फॉलो करते हैं, मेज के ऊपर अगर कोई ज्यादा खाते हैं तो उनके अंदर लैक ऑफ ट्रिप्टोफैन हो जाता है. ओके सो इट इज NAD and NADP. NAD and NADP are the isoenzymes. NAD and NADP are, no, sorry, not isoenzyme. They are the coenzyme form of vitamin B3. Coenzyme form of vitamin B3. Deficiency leads to diseases called as diarrhea. Okay, dementia. Okay, and patient will also have dermatitis. So the dermatitis specifically seen in the exposed to sunlight areas, especially in this neck region called as Kahal necklace. It's pronounced as a Kahal's necklace. Okay, which is also called as a Casal necklace. Kahal are Casal necklace. Kahal are Casal necklace. Kahal are Casal necklace will be the clinical appearance of your dermatitis, and this is an image based question. बहुत बार पूछा गया है. So there are only 2 images of exposed neck के बारे में 2-3 images commonly use करते हैं. That will be the question asked to people. So the next one, if the patient left untreated, automatically it will land up in the death here. Land up in the death. So these are the clinical features of what? Clinical features of B3 deficiency. Okay. So decreased tryptophan, decreased niacin. B3 synthesis requires which vitamins? Help of B6. Help of B6. Okay. So this is the important key points of vitamin B3. Okay. Once we understood about the vitamin B3, let's go to the next aspect. The next aspect, my dear students, B5. B5 is also called as a pantothenic acid. Pantothenic acid. Okay, pantothenic acid. So this pantothenic acid is such a type of vitamin which deficiency leads to burning food syndrome. Burning food syndrome. Burning food syndrome. Okay, deficiency leads to burning food syndrome. Okay, burning food syndrome अलग होती है, restless leg syndrome अलग होती है. Restless leg syndrome is different from the burning food syndrome. Restless leg syndrome is different from burning food syndrome. Okay, burning food syndrome is a clinically symptoms of burning food which are a sensory symptoms. Okay, now let's talk about the vitamin B6. Vitamin B6 is also called as pyridoxal phosphate. Vitamin B6 is also called as pyridoxal phosphate. So vitamin B6 so deficiency, vitamin B6 deficiency and excess both have the same clinical feature. So what are the clinical features of B6 and excess and the deficiency of B6 and the role of B6 in the body? This is a very important. What is this B6? B6 is also called as pyridoxal phosphate. It's also called as pyridoxal phosphate. This pyridoxal phosphate is something which is having, what is that? This is having a coenzyme function. Okay, it's a coenzyme for mainly for carboxylases. Decarboxylations. Okay, decarboxylases. So it's a coenzyme for decarboxylases. It's a coenzyme for what? decarboxylases. So vitamin B6 is a coenzyme for decarboxylases. Is a coenzyme for decarboxylases. So let me explain how this works. Okay. So the function and the role. Okay. So you have an amino acid called as glutamate. You have an amino acid called as glutamate. Okay. So glutamate is a type of excitatory neurotransmitter as well. Excitatory neurotransmitter. Okay, so this excitatory neurotransmitter, whatever is there, which undergoes a reaction called as a glutamate decarboxylase, in the enzyme effect called as glutamate decarboxylase, right? It will give rise to somebody called as gamma aminobutyric acid, which is a inhibitory neurotransmitter. Which is a inhibitory neurotransmitter. So glutamate decarboxylase will convert glutamate, an excitatory neurotransmitter, into inhibitory neurotransmitter. Here we require a vitamin B6 my dear बच्चों. ये बहुत इंपॉर्टेंट कॉन्सेप्ट आपको लग सकता है कि सर आप क्यों ऐसा कर रहे हो कि as if where you are teaching us a theory. So I am not doing it on purpose, but these are the commonly asked questions where students make a lot of silly mistakes. I don't want anyone to make such type of mistakes, so that's why. Okay, so you have vitamin B6, right? So in the morning sickness, the drug of choice is what? In the morning sickness, the drug of choice is what? All of you are going to tell one thing. You are going to tell the answer in the morning sickness. What is the drug of choice? The drug of choice is your doxylamine. What's the drug of choice? Doxylamine. So when we are treating the morning sickness patient, we do not give the doxylamine alone. We are going to combine it with vitamin B6, because vitamin B6 increase the GABA production. Increased GABA production will going to suppress the CNS, suppress the central nervous system. Because of that, there is a decrease of vomiting. Decrease of vomiting. Okay, so doxylamine will do what? Doxylamine will decrease the vomiting. Along with if B6 is added, the effect will be better. Why? They can ask you why B6 is added. Why? Because B6 is the coenzyme for glutamate decarboxylase. समझ आई बात? Okay, so that is the story of your glutamate. Let's go to the next concept area. What is the next concept? So since we spoke about morning sickness, let's talk about the mountain sickness as well. Mountain sickness. So since we spoke about the mountain sickness, so morning sickness, let's talk about the mountain sickness. So this is a mixed topic of biochemistry and pharmacology. So I don't want anyone to make a mistake. So let's try to understand. Okay. So what is this mountain sickness? Mountain sickness, what happens? So a person goes to a high altitude, right? So when a person goes on a high altitude, like some place, like for example, a person went to Ladakh, let's keep, okay, person kahan gaya tha? Ladakh. So when they go to the high altitude, there is a decrease of PO2. There is a decrease of PO2, partial pressure of oxygen. So because of that, there is a decrease of oxygen supply, leading to a hypoxia called as a hypoxia, right? Okay, so there's a decrease of partial pressure of oxygen. If there's a decreased partial pressure of oxygen, how your body is going to compensate for that? It's going to compensate by hyperventilating, means it will start to increase the respiratory rate. So the person will become like this. Why? Because he wants to consume more air. So there is an increase of respiratory rate. So increase of respiratory rate will also cause a loss of CO2. Loss of CO2. Loss of CO2 will lead to respiratory alkalosis. Now the story of high altitude one is over. Okay. For example, there is one more scenario. So in a flight, at some high altitude, flight at a high altitude, right? So flight at a high altitude, there is a sudden depressurization, right? So if there is a sudden depressurization, So immediately what will happen? So there will be decrease of PO2, decrease of PO2. There is a severely person is going to suffer from hypoxia, Okay. Now in both the scenarios we have, and I'll give two options. Option A, acetazolamide. Option B, immediate descent. Okay, these are the two options. Okay, so in the scenario number one, this is the scenario number one. So tell me the answer for scenario number one. What is your treatment for scenario number one? So what will your advice? What will be your thinking? What will you do for the scenario number one? Scenario number one. Come on, tell me for the scenario number one, first scenario. Habibi, come on, tell me. So you people are telling me the option is B. First descent. Very good. Very, very good. Though the answer is first immediate descent for the flight. At a high altitude, here you are going to give the acetazolamide. Here you are going to give the acetazolamide. So for a high altitude, you are going to give the acetazolamide. For the flight, you are going to tell the immediate descent. Okay. Sir, for both the scenarios, give acetazolamide. If you can give the acetazolamide for the both the scenarios, then why do flights have an oxygen mask? Right? They announced, right? In the event of cabin depressurization, the mask will fall from the panel above your head. Apply your own mask before helping other. Apply the mask like this, covering the nose and the mouth. Okay, so apply your own mask before helping others. Right, this is the announcement. Okay, so why they may expect you? Because suddenly there's a depression, there's a sudden lack of oxygen in the atmosphere. ओके सो इसीलिए उसको क्या करोगे इमीडिएट डिसेंट के लिए बोलोगे ठीक है अगर पेशेंट को तुम बोलोगे देयर इज अ कैबिन डीप्रेशराइजेशन भैया एस्ट्राजोलामाइड ले लो एसिटोजोलामाइड हाँ मरोगे सब लोग ठीक है ऐसा नहीं होना चाहिए सो यू आर नॉट गोइंग टू टेल द पेशेंट इन द इवेंट ऑफ कैबिन डिप्रेशन यू आर नॉट गोइंग टू गिव एस्ट्राजोलामाइड ओके डोंट गेट कंफ्यूज्ड and this is a question of common sense okay now main role of main mechanism of action of acetazolamide in mountain sickness. This is again new trap. This is again previously asked question. Okay, mountain sickness. Okay, so here I am combining physio, biochemistry and pharmacology, all three of them, but still this is a very common question. Okay, so options I'll give. Option A, it caused the loss of HCO3 minus from the proximal convoluted tubule and lead to metabolic acidosis. Okay, option B, it will prevent the CO2 loss. Okay, option C, prevent the bicarbonate loss. Option D, none of the above. बताओ सर जी everybody come on tell me come on please tell me what is the answer. The main mechanism of action of acetazolamide in mountain sickness, it will cause the loss of HCO3 minus in the PCT and cause the metabolic acidosis. So that is your answer, or prevent the CO2 loss, or prevent bicarbonate loss, or none of the above. What is the mechanism of action of acetazolamide? So acetazolamide is a type of carbonic anhydrase inhibitor. Acetazolamide is a carbonic anhydrase inhibitor. Now I need an answer. So Muskan Goyal tells the answer is C. MSPK doctor telling C. Knight telling C. Acha. Okay. So Knight is telling A. Now answer बदल गया. बचा हुआ लोग अरे आप बताओ ना हम रट लेंगे बचा हुआ लोग और कई लोग हैं सर तो हम तो सो गए है ना समझे. The answer is the main mechanism is remember It prevents the CO2 loss. It prevents the CO2 loss. It prevents the CO2 loss. So that is the main mechanism of acetazolamide. Acetazolamide. Okay. Very good answer. Okay. Harsha, you're absolutely correct. Okay. So what is that? The answer is prevent the CO2 loss. So this is the first and important mechanism. Okay. Important in mountain sickness. This is the important in mountain sickness, and in the mountain sickness A becomes the second one. Okay, so kaisa, so please understand, so carbonic anhydrase is an enzyme which is also present in the lungs. Okay, so since we spoke about morning sickness and mountain sickness, so for the motion sickness the drug of choice is a scopolamine patch. It has to be given prior to the onset of the journey, at least 3 to 4 hours prior, ideally speaking. Kuch nahi to before the onset of motion sickness we have to give the motion sickness patch, is preferably in the ear, behind the ear. Okay, so let's go to the next concept. What is the next concept? The next concept is that so the role of B6, only B6 ka role bahut important hai. Okay, there is an amino acid called as tryptophan. There's an amino acid called as a tryptophan. So this tryptophan amino acid undergoes hydroxylation. Okay, so undergoes hydroxylation. It will give rise to 5-hydroxytryptophan. 5-hydroxytryptophan. This 5-hydroxytryptophan undergoes decarboxylation, removal of CO2, leading to a production of a substance called as 5-HT, that is only 5-hydroxytryptamine. 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 So the key point you need to remember here is that 5-hydroxytryptamine. इसका full form भी पूछा गया. So previously in the olden papers they had asked what is the full form of 5-HT? 5-hydroxytryptophan or tryptamine? The answer is tryptamine. Here also you require vitamin B6. Okay. Then vitamin B6 is also required where else? Vitamin B6 is also required for transamination. Okay, what is transamination? We'll understand in the chapter of your, what is that? Chapter of your proteins and amino acids revision under important concepts there. Okay, now the answers to know. So this is the story of your B6 deficiency. B6 deficiency and excess both will cause a similar clinical feature. The clinical features include peripheral neuropathy. Peripheral neuropathy. The patient can develop a microcytic sideroblastic anemia. Microcytic sideroblastic anemia. Okay, blastic anemia. Okay, they might ask you why anemia, why microcytic anemia. Why microcytic anemia? A patient with B6 deficiency developed what is that? Developed microcytic sideroblastic anemia. Okay, so why it occurs? Why? Why? Pachimu. Why? Enduku. Q. Yake. So let me answer this question. Why? Because B6 is the coenzyme for B6 is the coenzyme for what? Coenzyme for something called as ALA synthase. B6 is the coenzyme for ALA synthase. ALA synthase is the rate limiting enzyme of heme synthesis. Heme synthesis. Okay, so very important to understand. If there is no B6, there is no action of ALA synthase. If there is no action of ALA synthase, there is no heme production. If there is no heme production, that will lead to what? Microcytic anemia, because there is no heme, there is no sufficient heme, there is no hemoglobin. RBC cell size is going to shrink. RBC cell size is going to shrink. You get it? So this is a story of your what? This is a story of your B6 deficiency access the clinical feature. So deficiency ka cause. Okay. The cause for the deficiency, my dear students, you need to remember one of the drug isoniazid. isoniazid. In which group of people, in which genetic variation, they'll ask you which genetic variation of isoniazid will cause the B6 deficiency. Okay, this is a very important question for you people. In which group of people? In the patients who are slow acetylator. In the patients who are slow acetylator. In the slow acetylators of isoniazid consumption, and if there are slow acetylators, then definitely patient can develop, what is it? Patient can develop your B6 deficiency, and these are the clinical features. Okay, so once we understood about this, let's go to the next vitamin, vitamin B7. B7 is also called as biotin. So biotin deficiency, the biotin deficiency is seen in raw egg consumption, in the raw egg consumers, raw egg consumption, raw eggs use. Okay, and this will lead to alopecia. The other name for the deficiency will lead to alopecia. The B7 is also called as biotin. Okay, now let's talk about the B9. B9 and B12, their role is very important. Again, B9 deficiency leads to megaloblastic anemia, and also the patient who is having a B9 deficiency will have, what is that? Will have the elevated level of homocysteine, okay, and also this B9 deficiency people, if the pregnant female, so the baby will get a neural tube defects. So let's quickly talk about the B9's metabolism. So we have other name for B9 is folic acid. Okay, so let's talk about the folic acid related. Okay, so quickly let's discuss and understand the folic acid. So you consume folic acid from the food. Okay, so the folic acid absorption will occur from where? Absorption will occur from the jejunum. So majority of the absorption occurs from the jejunum. This folic acid, under the influence of an enzyme, dihydrofolate reductase, which what is the name of the enzyme? Dihydrofolate reductase. What is the name of the enzyme? Dihydrofolate reductase. It will get converted into dihydrofolate. Okay, this dihydrofolate, again under the influence of the same enzyme dihydrofolate reductase, it will give rise to, what is that? Tetrahydrofolate. Okay, so this tetrahydrofolate, whatever is there, this tetrahydrofolate will further get converted into what? The tetrahydrofolate will further get converted into, so there is something called as 5,10 methylene tetrahydrofolate. Methylene tetrahydrofolate. This 5,10 methylene tetrahydrofolate, while it is going back into the tetrahydrofolate, when it go back into the tetrahydrofolate, under it will also give rise to UMP. Okay, so DUMP to DTMP, that is a type of nucleotide. So nucleotides are responsible for the cell replication. Nucleotides are responsible for the DNA formation, which is responsible for the cell replication. So what is the enzyme required? We require an enzyme called as thymidylate synthase. What is the name of the enzyme? Thymidylate synthase. Again, from your pharmacology, this was a previously asked question. What is the previously asked question? Which drug deprives the cell from having sufficient of thymidylate? Thymidylate monophosphate is a nucleotide. Nucleotides are responsible for the making of DNA and RNA. So basically, especially DNA here, when we are speaking of TMP, if there is no DNA, there is no cell replication. So for the synthesis, that is which one is required? Thymidylate synthase is required. Thymidylate synthase can be blocked by, inhibited by a drug, that's only a 5-fluorouracil. Okay, so methylene tetrahydrofolate will get converted into methyl tetrahydrofolate. So there is a possibility it can go for nucleotide synthesis, and also it can go for a methyl tetrahydrofolate. This methyl tetrahydrofolate, whatever is there, it is responsible for homocysteine metabolism. homocysteine metabolism. Okay, so this is the story of your what? This is the story of your B9. Once we understood about the B9, let's go to the last two vitamins. Which are those two vitamins? Let's talk about B12 and vitamin C. So B12 is also called as cyanocobalamin. Cyanocobalamin. Okay, so it is responsible for myelin synthesis. So myelin synthesis and the deficiency leads to neurological clinical features, and also their deficiency will lead to megaloblastic anemia, and also there will be increased level of homocysteine, and also homocysteine, and also there you can find increased level of methyl melanoic acid. Okay, vitamin C is also called as ascorbic acid. So this ascorbic acid has some role. Let's try to understand. So the role of the ascorbic acid is one of the main role, as all of you know, it's a very potent antioxidant, right? So being an antioxidant, it is also responsible for collagen formation. Okay, so what is that? It does the post translational modification of collagen. Post translational modification of collagen. Post translational modification of what is that? Collagen. Post translation modification. What is that modification? It will modify, so it will change the proline amino acid in the collagen will get converted into hydroxyproline. Hydroxyproline means, so in the chain of collagen is a protein. All the proteins are made out of amino acid. So after the collagen is synthesized, wherever proline is there, it will convert that proline into hydroxyproline, and even lysine, wherever it is there, lysine will get converted into hydroxylysine. Okay, so this is a story of your what is a post translational modification. Okay, so collagen is a structural protein which is responsible for wound healing, which is responsible for your health of the basal, basement membrane. Okay, it is responsible for the functioning of many parts of our body. So the deficiency will lead to what? Deficiency will lead to scurvy. ओके, इट्स नॉट कर्वी. ओके, तुम लोग जो कर्वी कर्वी सोच रहे हो वो नहीं, ये स्कर्वी है भैया. ठीक है, इट्स ए स्कर्वी. Okay, so the scurvy will be there. The scurvy patients will have clinical features such as rashes. Okay, why rashes? Because the rashes will occur as a result of small petechial hemorrhages in the skin. Small petechial hemorrhages in the skin will lead to what is that? Will lead to scurvy. Okay, and also the person will have gum swelling and bleeding. Gum swelling and bleeding is possible. Okay, apart from that, there will be poor wound healing. Poor wound healing. This is also very important. Okay, and only if it is in the newborns or children or small children, then it will affect the bones also. It will affect the small bones. Which bones? Large bones or small bones? It will affect the small bones. Small bones will be affected. Small bone development is also affected. So this is a story of all the key points. Pretty much I have covered almost all the question which was asked in last 2 to 3 years. में जितने भी vitamins के बारे में पूछा गया है, almost everything has been covered, my dear students. Okay, so this is a story of your what? A story of your chapter of vitamins. Okay, so with this much being said, so we are done with the vitamins chapter. We'll go to the other chapters which will become easier for us. So here I have spent more time, but all the previous topics and the questions which has been asked is covered for you people. Okay, so followed by this, let's take a small break of 10 to 15 minutes. So it's 7:43. So let's talk till 7:53. Okay, 7:50. Let's make it 7:55. So break till 7:55. Take a break till 7:55. Then we will continue. All right, everyone, shall we continue? So let me open the link. So by 9:30, 10 we'll finish the class. By 9:30, 9:45. Okay. So once we understood about the vitamins, let's go to the next concept. The next concept is your, what is that? That is only your lipids. Okay. So lipids is a very important chapter as compared to the vitamins, less important. Okay. But when we are speaking of lipids, lipids is a chapter in which direct MCQs will be asked. Which enzyme deficiency causes which type of disorder? That's the most important concept which can be asked to you people with respect to biochemistry. But in the lipids, about lipoprotein metabolism and the drugs acting through which can be asked from the pharmacology. So be prepared with that. That's becoming a very favorite topic of examiner. That's becoming a very favorite topic for the examiner, because these questions have been previously commonly asked again and again regarding the lipoproteins and the lipid balance in the body and the dyslipidemia drugs. Okay, so let's start off with the lipids. So lipids, to understand that lipids, so lipid is a type of substance which is a combination of two things. One is fatty acid plus a alcohol. Okay, so which is the alcohol present in the body? Don't tell your old monk Glenwit and all. Okay, I'm not asking the alcohol which you drink. The alcohol which is present in the body along with the lipids. One of the classic example we have is glycerol. What is that? Glycerol. Okay, फिर बाद में बोल दिया कि सर हमारा बॉडी के अंदर तो ग्लेनविट था. ठीक है ना भैया. ठीक है. So to this fatty acid, if I add a alcohol only, then it becomes a lipids. So lipids can be divided into two groups. One is simple lipid, one is complex lipid. One is simple lipids, one is complex lipid. So simple lipid is a fatty acid and a alcohol. Complex lipid is a fatty acid, alcohol. There will be other group. There will be some other group. Okay, other group means fatty acid, alcohol, plus if something else is there. Okay, then we are going to call it as a complex lipid. So the complex lipid can be of three types. One is phospholipid. Phospholipid is a combination of fatty acid plus alcohol group plus your, what is that? That is phosphate group. That is only your phospholipid. You have fatty acid plus alcohol plus your carbohydrates. If it's present, we'll call it as a glycolipid. Okay, if phosphate group is there, phospholipid. If protein group is there, if protein along with the lipid, if protein is there, then we'll call it as a lipoprotein. The classic example for the lipoprotein is your apoprotein, apoproteins. Okay, guys, just give me 1 second. There's some emergency call I'm getting. Let me take it. I think it's a family call. Let me just answer that. I'm really sorry for that. Okay, there is some family emergency, so they were kept on calling. So, anyways, so if we are speaking of proteins, the lipoproteins, which are called as apoproteins. Okay, so the protein part of the lipoprotein is called as apoprotein. Okay, so structure of a lipid is RCOH. What is RCOH? R is a side chain which is having a long chain of carbons along with the acidic group, which is COH group. Then we'll call it as a fatty acid. So fatty acid का functional group क्या होता है? What is the functional group of the fatty acid? That is your carboxyl group. So let's talk about the glycolipids. See, these basics everyone knows. So glycolipids. Glycolipids is what? Glycolipids is the substances which having a fatty acid, alcohol, and a carbohydrate, right? So carbohydrate can be monosaccharide. Carbohydrate can be oligosaccharide, right? So if it is a monosaccharide, okay, if it is a monosaccharide, so monosaccharides are called as cerebrosides. What do I mean by this? Not exactly monosaccharide, but lipid plus a monosaccharide, lipid plus a monosaccharide. If they are together, then we will call it as a cerebrosides. They are called as a cerebroside. Okay, thank you, Dheeraj. Okay, So now listen to me very carefully. What is that? Lipid plus monosaccharide. We are going to call it as what? We are going to call it as a cerebroside. So monosaccharide can be anything. What is that? We have glucocerebroside. What is a glucocerebroside? Glucocerebroside is a substance which is made out of lipid plus glucose. Lipid plus glucose. So if lipid plus glucose, if it is present together, we are going to call it as what? We are going to call it as a glucocerebroside. These glucocerebrosides are responsible for the membrane function of the neurons. Glucocerebrosides are responsible for the membrane function of the neurons. It is digested by the enzyme. Okay, so with digested by the enzyme glucocerebrosidase, its deficiency leads to Gaucher disease. So here direct by-heading thing to be done. Glucocerebrosides are metabolized by glucocerebrosidase. Deficiency leads to Gaucher disease. So in the Gaucher disease, there is an accumulation of glucocerebrosides. Accumulation of glucocerebroside. Why? Because there is nobody to digest them. If there is nobody to digest them, they will start to accumulate. Then we have galactocerebroside. Galactocerebroside is a fatty acid plus alcohol, which is a type of lipid. It's a type of lipid. So lipid along with that, if there is a galactose, if it is a galactose, which is a monosaccharide, which is the epimer of the glucose, so then we're going to call it as a galactocerebroside. We're going to call it as a galactocerebroside. This galactocerebroside, whatever is there, so this galactocerebroside is metabolized by an enzyme, galactocerebrosidase. Again, all the cerebrosides are responsible for the membrane function of the neurons. Okay, so the galactocerebrosidase is having two variations, alpha variation and beta variation. What is this variation? Variation is not a proper term to tell. So it has two isoenzyme, alpha isoenzyme and a beta isoenzyme. Alpha deficiency leads to what is that? Fabry's disease. Alpha deficiency leads to what? Fabry's disease. Beta galactocerebrosidase deficiency leads to what? Krabbe's disease. Which disease? Krabbe's disease. Krabbe's disease occurs as a result of what? Occurs as a result of beta galactocerebrosidase deficiency. Then we are going to the next concept, that is only gangliosides. Ganglioside is a combination of your lipid plus oligosaccharide. Lipid plus a oligosaccharide. So these gangliosides are represented by the alphabet GM. They are represented by the alphabet GM. So these gangliosides are further classified into GM1, GM2, GM3. Okay, I am interested in GM1. So GM1 का function क्या होता है? Again, it's responsible for the membrane function, but it has a clinical importance where in the intestine it acts as a receptor for somebody, receptor for a toxin that is a cholera toxin. For the cholera toxin, it acts as what? It acts as the receptor. Okay, so we have GM3 are considered to be the simplest ganglioside. Now all these gangliosides, this is just an unnecessary thing for you people, but for the general knowledge you can remember, these gangliosides are used and tried in a clinical research for the treatment of many types of cancers, but as such there is no established commonly used treatment, so you don't have to worry about it. Okay, GM2 are metabolized by an enzyme. The name of the enzyme is called as a hexosaminidase. Okay, hexosaminidase. So hexosaminidase has two isoenzymes, alpha subtype and beta subtype. Alpha deficiency leads to Tay-Sachs disease. Alpha subtype leads to Tay-Sachs, and beta deficiency leads to Sandhoff's disease. Beta isoenzyme deficiency leads to Sandhoff disease. This is one place of the biochemistry where you have to remember or by heart lots of what is the disease name and the enzyme deficient. So you need to give some time here, but I pray that they ask these questions to you people. क्यों पता है? रट के जाना, क्वेश्चन आएगा, पक्का करेक्ट आंसर मार्क करोगे. So you by heart it, go to the exam. If they ask the question, 100% with a guarantee. Okay, with a guarantee you'll mark the correct answer. So that becomes advantage, very much advantage. That is the difference between 149 and 150, right, for us. Okay, तो यहाँ पे भाई आपका comment box देखना बहुत जरूरी है, नहीं तो मजा नहीं आएगा क्लास पढ़ाने में. Okay, so let's continue to the next aspect. What is that phospholipids? So phospholipids, I need you to understand one important concept. What is that? So phospholipids can be divided into two types. One is called as glycerophospholipid and sphingolipid. and sphingolipid. Okay, so glycerophospholipids such as kefalin, examples. Okay, you have kefalin. Okay, so what is it? Kefalin. You have one more glycerophospholipid called as lecithin. Okay, where is lecithin found? It's one of the predominant phospholipid in your surfactant, dear. It's a predominant one in the surfactant. Then you have your sphingolipid. So the classic example is sphingomyelin. Sphingomyelin. The word itself, myelin, the word itself is very clear. It is responsible for the nerve function. It is responsible for the covering of the neuron. That is a myelin sheath. So that sphingomyelin is metabolized by an enzyme called as sphingomyelinase. अरे rule बहुत simple है भैया. Rule is very simple. అర్థం చేసుకోండి. చాలా simple rule. అర్థం ಮಾಡ್ಕೊಳ್ಳಿ. సమజ్లో పురింజుగోంగా. The rule is very very simple. Any substances such as phospholipids or cerebrosides which are produced in the body has to do their function and has to get digested. Okay, for their digestion they have particular enzyme. If there is no digestion, means if there is a deficiency of some enzyme, there is no digestion of that particular lipid. So that particular lipid will not get deposited. If there is some substance is excess in the body, it will start to accumulate in the wrong places. It will start to accumulate in the wrong place. So if it start to accumulate in the wrong places, it will lead to deposition and improper function of that particular part of the body. Okay, all right. So as we speak, so there is a disease called as Niemann-Pick's. In the Niemann-Pick's disease, there's the deficient enzyme is sphingomyelinase. Sphingomyelinase deficiency, you can find the foam cells. You can find some cells called as foam cells. These foam cells also seen in which disease? Pathology. But also seen in foam cells are seen in Niemann-Pick's disease and one more disease where you find these foam cells. What is this foam cells? Chepandi, tell me. Bataiye sir ji. So also seen in your disease called as atherosclerosis. Atherosclerosis. Okay, also seen in your atherosclerosis. Okay, so the next concept of phospholipid which you need to understand, what is that? The next concept is very easy to understand, my dear students. What is that? That is, if you consider this is a cell membrane. Cell membrane is a single layered or a bilayered? Bilayered. Okay, so you study, right, lipid bilayer membrane. So there is an inner layer and there is a outer layer. Okay, so in the inner layer there is a specialized phospholipid. Okay, the name of the phospholipid is called as phosphatidylserine. What is it called as? Phosphatidylserine. Okay, so when we are speaking of phosphatidylserine, so what is this phosphatidylserine? It is a phospholipid which is present only and only in the inner surface of the cell membrane. It's present only and only in the inner surface of the cell membrane. So from the inner surface, we have a protein called as, phospholipid called as phosphatidylserine, which comes out of the cell membrane, that is, which is leaked out of the cell membrane during the process of apoptosis. So apoptosis ka time pe we use a stain called as annexin stain. This annexin stain will stain your phosphatidylserine. Okay, so phosphatidylserine, if it is freely present, right, only then annexin can go unbind. So if annexin positive, if I tell you what annexin positive, that means what? Annexin positive, it clearly suggests that there's a leakage of the phosphatidylserine. This phosphatidylserine, whatever is there, so this will be leaked out only in the time of apoptosis. So if annexin stain positive, that is suggestive of apoptosis being going on somewhere in that particular tissues. Okay, so that is how you need to recognize the staining in the apoptosis. Apoptosis ka stain kya hota hai? Annexin stain. Okay, so that is a story of your what? That's a story of your phospholipids. Let's talk about the lipoproteins. So when we are speaking of the lipoprotein is a combination of three things. What is that? Lipoprotein is a combination of fatty acid, alcohol, and a protein. So the protein which are present inside a lipoprotein are called as apoprotein. So apoprotein metabolism is important for us. So basically lipoprotein metabolism, how your body handles the lipoproteins, let's try to understand. Okay, so now Let's try to understand this. So this is a quick review of, I'll tell you, because sir, why are you teaching us some concept during the time of revision? I'm putting the time to teach you people this concept instead of skipping. The reason is very simple. This creates a great base for the understanding of rest of your pharmacology related to this topic. So let's quickly go through that. Okay, आप लोगों को तो लिखने का जरूरत है, बस मेरा बात सुनो, एकदम मैं तुम्हारा दिमाग में प्रिंट कर दूंगा. ठीक है सर? Okay, all right. So food. So from the food, there is a fats, there is a lipids. There is what? Lipids. Okay. So from the food, lipids will come into the intestine. Lipid will come into the intestine. Will they get absorbed directly? Lipids, can they get absorbed directly? Is it possible? Is it possible to get absorbed? No. Why not? Lipids will not get absorbed directly. Why not? So not just the lipids, many substances, their absorption depends upon what? So remember one dialogue. What is the dialogue? Size matters. Okay, size matters. For what? For absorption. Arey soch badlo. Change your thinking. I'm talking about size matters for the absorption of the molecules in the GAT. Larger the size, lesser the absorption. Smaller the size, better the absorption. Soch badlo. Okay? So smaller the size, better the absorption. So these lipids will break and will undergo emulsification. Emulsification. Okay, so what is that? Emulsification. There will be what? Emulsification. So during the process of emulsification, so that will lead to the form. They will form what is that? Something called as chylomicrons. Chylomicrons. So chylomicrons are loaded with the small lipid particles. Small lipid particles are loaded onto the chylomicron. So these chylomicrons, okay, enter the portal circulation. Enter what circulation? Portal circulation. Portal circulation. Okay. So where are chylomicrons now? They are in the portal circulation. They are in the portal circulation. Who are they? Chylomicrons. Who are they? Chylomicrons. Now these chylomicrons, whatever has gone, so these chylomicrons in the portal circulation under the influence of an enzyme, lipoprotein. Okay, influence of alcohol nahi hai, under the influence of lipoprotein lipase. Under the influence of which enzyme? Lipoprotein lipase. Okay, so they will take up some free fatty acids. It will take up some free fatty acids. So once it takes up the free fatty acids, so the remaining part of the chylomicron, we will call it as a chylomicron remnants. Chylomicron remnants. Okay, so this chylomicron remnants, whatever is there, sir, so they will go to the liver. They will go to the liver. So in the liver, who has come? We have chylomicron remnants. Okay, so the chylomicron remnants, they bring the fats. They bring the fat. Okay, so they bring the fats. Okay, so triacylglycerides. Okay, triacylglycerides. Okay, they bring the fats, triacylglycerides, and also other lipids such as cholesterol ester. C means cholesterol esters. Okay, now liver will pack all the cholesterol, all the lipids packed into somebody. All the lipids packed into VLDL, मतलब very low density lipoprotein. So जिसके अंदर there is a high amount of fat. There is a high quantity of lipid. There is a high quantity of what? Lipids. There is a high quantity of what? Lipids. There is a high quantity of lipids. So now this VLDL goes to the circulation. Goes to the circulation. So goes to the circulation and to the tissues. And to the tissue. Now VLDL. So who has come to the tissues and circulation? VLDL. Now VLDL, what it will do, my dear students, it will going to give away some free fatty acids to the tissues. Free fatty acid to the tissues. Okay, so after giving, it will form IDL, intermediate density lipo. So this intermediate density lipoprotein will also give to the fatty acid to the tissue, free fatty acid to the tissues. Okay, so after giving, it will become into LDL. Matlab, now remember, highest fat is in VLDL. lesser fat in ideal, even less fat in LDL, even less fat in LDL. Okay. Now this LDL will also give fat to free fatty acid to tissues, free fatty acid to the tissues. It will become into high density lipid. So high density lipoprotein is having less amount of less lipid, less lipid. This lipid is what? मतलब कुछ नहीं यार, लिवर ना सारे फैट को लिया, एक के अंदर पैक किया, एक ट्रक के अंदर पैक किया. वो ट्रक का नाम क्या था? VLDL ने गया किसके पास? स्किन के पास. It has gone to the skin, to the skin. What it will tell? Skin, how much cholesterol you need for vitamin D? Skin will tell this much. Okay, VLDL will unload the cholesterol. After that, VLDL will come into ideal. Now, ideal will go to, for example, adrenal gland. In the adrenal cortex, it will give away some cholesterol. Now, ideal will become into, what is that? LDL. Now, LDL will go to, for example, testicles. It will give away some free fatty acid. After that, the remaining, so it has distributed to all the parts of the body. After that, whatever remaining cholesterol is there, so that cholesterol will be taken by HDL. So this cholesterol will be present in the form of HDL. So it has a less lipid, which is after giving to all the body parts, the remaining cholesterol is present in the HDL. Now this HDL, भैया सबको तो distribute हो गया. Skin have you got? Yes sir. For example, testicles have you got? Ovaries have you got the cholesterol? Yes sir. For example, adrenal gland, have you got the cholesterol? Yes. After giving to everybody, the remaining cholesterol, HDL will take the truck. That is, HDL will take the remaining cholesterol and go back to the liver. Will go back to the liver. Will go back to the liver. So it is going back to the liver. It's going back to the liver. So it will go back and give the remaining cholesterol to the liver. So सारे remaining cholesterol को वापस लेके आता है कौन? Who is the one which is bringing everything back? Who is the one which is bringing the remaining cholesterol back? HDL. Who is it bringing? HDL. But this LDL and VLDL, LDL and VLDL can also go back to liver. Can also go back to liver. Go back to liver. So if they can go back to liver, our question is what? Question, sir, कब जाएगा? कहीं को जाएगा? Yes or no? Why it will go? When it will go? Only if liver need more cholesterol. Liver need more cholesterol. More cholesterol. Okay, so जब liver को ज़्यादा cholesterol चाहिए, तब this VLDL and LDL can go back. So exactly by the help of some receptor, by the help of LDL receptors. LDL receptors are located where? On the liver. LDL receptors on the liver. So basically, if liver के पास cholesterol है, but liver wants more cholesterol. When liver wants more cholesterol, liver will give the signal. What is that signal? So it will improvise the LDL receptor. जब ज़्यादा LDL receptor होगा, LDL वापस चले जाएगा. नहीं तो LDL will remain in the tissue. So LDL and VLDL will go back to the liver only during the time where there is a increased expression of LDL receptor. That expression will occur only if liver needs more amount of cholesterol, but in a natural pathway, the remaining cholesterol is brought back to the liver by the help of your what? HDL. So who are the ones which are bringing the cholesterol from where to where? From the liver to the tissues, from the liver to the tissues, VLDL, IDL, LDL. But LDL is the most dangerous because highly reactive lipoprotein, and it will get oxidized and start to accumulate in the blood vessel, leading to atherosclerosis, who is naturally doing the reverse transport of cholesterol. The reverse transportation of the cholesterol is done by high density lipoprotein. So the good one is HDL, the bad ones are LDL and VLDL. So this is a story of your water. This is a story of your लिपिड्स का लाइपोप्रोटीन. सो उसके अंदर वी हैव अपोप्रोटीन, मतलब प्रोटीन पार्ट ऑफ व्हाट इज दैट? प्रोटीन पार्ट ऑफ द lipoprotein can interact with the receptors such as PPAR gamma. Okay, sorry, not gamma, PPR alpha. I'm really sorry. PPR gamma is for thiazolidinediones. I'm really sorry. So PPR alpha. So basically, so apoprotein जो भी होता है, whatever the protein part of the lipoprotein. Protein part of the lipoprotein is what? Apoprotein. ये कुछ ना कुछ काम तो करना चाहिए. It has to do some work. What is the work it's gonna do? It interact with the receptor, nuclear receptor such as PPR alpha. Okay, so PPR alpha agonist, the stimulant drugs we have agonist, which ones? Now tell me the answer. What's the name of the PPR alpha agonist? Everyone, tell. Give a wrong answer. It's fine. It's totally fine. Give a wrong answer, but I need an answer. PPR alpha agonist. So there you are, fibrates. There you are, fibrates. Fibrates are PPR alpha agonist. Fibrates are PPR alpha agonist. Okay. Phenofibrate, clofibrate, zemfibrozil, all of them are what? PPR alpha agonist. Okay. And also these apoproteins can interact with the enzymes such as lipoprotein lipase with the help of apoprotein C, and they can also interact with an enzyme called as LCAT. Okay. It's not a lovely cat. It's a lecithin cholesterol acyltransferase enzyme which is activated by apoprotein A. Okay. Now, when we are speaking of very good, very good, very good. Those of you, क्योंकि यहाँ पे ना थोड़ा yes, you are absolutely correct. So यहाँ पे ना थोड़ा lag हो रहा है तुम्हारा आंसर और मेरा बोलने के बीच में, तो इसके मतलब ये नहीं है कि I'm ignoring your answer. You are absolutely correct. मुस्कान, you are absolutely correct. Phenofibrate, gemfibrozil. Okay, then agar मान के चलो somebody tells no, I will eat zero cholesterol. I will eat zero cholesterol. Your liver will tell, I don't care. I will produce the cholesterol because cholesterol is required for the synthesis of substances like bile acid. Cholesterol is required for the synthesis of sex steroids such as testosterone, estrogen, progesterone. This cholesterol is required for the synthesis of vitamin D. Cholesterol is required for the synthesis of aldosterone, which is a mineralocorticoid. Cholesterol is required for the synthesis of glucocorticoids. All the steroidal hormone synthesis occurs with the help of what? With the help of your cholesterol. With the help of cholesterol. So if you don't consume cholesterol or without cholesterol, can you survive? Nope, it's not possible. So even if somebody does not consume the cholesterol, but your liver will tell, don't worry, I'm here. Why you fear? It is going to do what? It is going to secrete its own cholesterol. How? Basically, it will take up acetyl CoA. It will take up two molecules of acetyl CoA. Acetyl CoA. It will convert it into something called as HMG CoA. It will convert it into something called as HMG CoA. This HMG CoA, under the influence of an enzyme, not any other substance, but HMG CoA reductase. Don't get confused. This is a rate limiting enzyme of cholesterol synthesis. HMG CoA reductase. So this HMG CoA reductase will convert HMG CoA into mevalonate. This mevalonate will further get converted into cholesterol. Okay, so the rate limiting enzyme is HMG CoA reductase. So this HMG CoA reductase, I need you to understand very, very important concept. This HMG CoA reductase is an enzyme which is more active in the night. Not about you being active. Okay, it's the enzyme being active I'm talking about. Okay, it's more active in the night. आप लोग तो रात में बहुत एक्टिव होते हो. अरे एग्जाम के लिए पढ़ने के लिए स्ट्रेस्ड आउट होते हैं तो नाइट में will be like stressed and will sit and will start to study even more actually. Okay, HMG CoA reductase is inhibited by statins. HMG CoA reductase is inhibited by statins. Okay, so the statins, which are the statins we have? Simvastatin, lovastatin, pitavastatin. गलत बोलोगे तुम पिट जाओगे. ठीक है, so pitavastatin, rosuvastatin, ठीक है, atorvastatin, out of which clinically right now used are atorvastatin and the rosuvastatin because of their longer T half. ठीक है, so that is a story of your, what is that story of your HMG CoA reductase. तो आप लोगों के लिए ना एक एडवाइस देते हो, तो डॉक्टर लोग ना we give advice to, so all of us will give advice to our patient. एक बढ़िया शानदार से एडवाइस देते हो. The advice is what, do not eat food, especially sugars, after 7 p.m. ठीक है, अब डॉक्टर लोगों का जिंदगी शुरुआत होता है बहुत लोगों का आफ्टर 7 p.m. Okay, so what happens, so many times what happens is very simple. So many patients will be like, They'll ask you, so what is the best time? Doctors goes very sincerely, okay? At evening 6:30 p.m. From today, remember one thing, you should not eat any food after 7 p.m. Okay, it's not good for your health because excessive cholesterol production will take place. Okay, don't eat any sugars after the 7 p.m. Why? That sugars will form acetyl CoA. Acetyl CoA will enter into cholesterol synthesis. Okay, but the same doctor will go home at 10 o'clock, okay, will eat, or if he's in the night duty, okay, this is a pain of every doctor. If you're in the night duty, you'll get tired in middle of the night and you start getting cases, okay, 12 बजे के बाद तो sometimes emergencies get busy, okay, अब डॉक्टर लोग काम करते करते थक जाते हैं हम लोग, okay, so when we get tired, so what we tend to do, हाँ, 12 बजे मंगाओ बिरयानी, at 12 a.m. order, like, at 2 a.m. order, for example, waffles, okay, choco lava cakes, मैगी, सब कुछ ठूस लिया रात भर, ठीक है, अब रात भर जितने भी शुगर खाए थे वो किधर में कन्वर्ट हो रहा था, that is only liver cholesterol. That is why we advise not to eat, but our life has become like that. We have no option. I'm not commenting our life, I'm telling the pain of our life. Why? Because most of the time the problem is that only we cannot give more focus on our health, because we are also going through the same problem. We are like, we are in a system like that. Okay, anyways, let's get back to the discussion. So what is the discussion we are going on? This cholesterol synthesis. Once we're done with the cholesterol synthesis, let's continue to the oxidation of fatty. Oxidation of fatty acid is purpose of to produce energy, to produce ketone bodies. Okay, these ketones will enter into Krebs cycle. Krebs cycle will give us the energy. Okay, so Krebs cycle will give us the energy. Okay, so the oxidation is nothing but a simple thing, breakdown of the fatty acids. So the breakdown of the fatty acids will occur for the production of ketones. Ketones will give rise to what is that? Will give rise such as acetyl CoA, for example. Acetyl CoA. Okay, this acetyl CoA enters into Krebs cycle. Krebs cycle gives the energy. So when we are speaking of beta oxidation, there are three types of, when we are speaking of oxidation of fatty acid, there are three types, beta, alpha and omega. Okay, so beta is the predominant type or a most common type. So predominantly in all our body, we are having what is that? Predominantly beta oxidation. Every beta oxidation remove 2 carbons from a fatty acid. Okay, मतलब क्या हो गया? ध्यान से सुनो, please understand. You have a fatty acid. Fatty acid has some 26 carbon atoms. Let's imagine how many carbon atoms were there? 26. I said this to my relatives and they are sharing their reports every time. See, I feel your pain. उस टाइम पे करना क्या चाहिए? रिपोर्ट तो देख के मैं ओपिनियन दे दूंगा, ठीक है, तुम क्यूआर कोड भेज देना, कंसल्टेशन फीस 250 रुपया डाल दो भैया, बस। बोलेंगे अरे रिपोर्ट देखने के लिए 250 रुपया? नहीं, रिपोर्ट देखने के लिए नहीं, रिपोर्ट कैसा देखा जाता है वो पढ़ने के लिए, जो हम लोग 10-12 साल पूरा डॉक्टर बनने के लिए हम लोग मतलब गुजरते हैं ना, और कुछ आता है मुझे बट नहीं बोलना चाहता हूँ, वो 10-12 साल हम लोग ने जो ये आते हैं मेहनत करके, तो उस इसका फीस होता है, ठीक है, ये डायलॉग बोल देना। चलिए, फैटी एसिड ऑफ 26 कार्बन एटम, इट अंडरवेंट बीटा ऑक्सीडेशन, so it will give acetyl CoA, plus you have 24 carbon atom fatty acid. Now this 24 carbon atom fatty acid again undergoes, it will give acetyl CoA and it will have 22 carbon atom. Okay, like this it goes on and on and on. So one fatty acid with 26 carbon atom can give 13 acetyl CoA. Can give how many acetyl CoA roughly? About 13 acetyl CoA. So every time fatty acid undergoes oxidation, it will create, and as it goes on and on and on and on and on, that goes and that will become into small one and keep on breaking into ketone bodies for the production of energy. So The oxidation predominant one is beta oxidation. Beta oxidation occurs in 3 stages. One is activation. Activation of the fatty acid occurs in the cytoplasm. So now this activated fatty acid, so basically this is your cell. So let's consider this is the mitochondria. So activation of fatty acid occurred where? Occurred in the cytoplasm. From the cytoplasm, it has to go into the mitochondria. So the transfer of fatty acid from the cytoplasm to mitochondria is done by your carnitine shuttle. What is that? Carnitine shuttle. Okay, so what is that? Carnitine shuttle. This carnitine shuttle will transfer the fatty acid from the cytoplasm to mitochondria. That is only done by carnitine shuttle. The same carnitine which is used for the promoting the weight loss during the gym or training sessions. They tell right, take carnitine. ओके जलवा तो है भाई हमारा ठीक है तो what is there, this shuttle is the one which will transport. So for the promoting the fat burning or weight loss process, we take the supplement L-carnitine. That's this only, the mechanism is same. So once that is done, that will enter into the mitochondria. The proper oxidation itself takes place in the mitochondria. Proper oxidation itself takes place in the mitochondria. So when we are speaking of this, let's go to the next concept here. So what is that? There is some oxidation, alpha and omega. Alpha and omega, last year they had asked about alpha oxidation, जो कोई notes में नहीं था, मैंने class में पढ़ाया हुआ था, वो notes में था. Okay, so anyways, so yes, that's a proud moment for me because I had predicted this might be the question and मैंने purposefully डाला था, done question आया था, बहुत खुश हो मुझे. ठीक है, now let's talk about the alpha oxidation. Alpha oxidation, whatever is there, so it's a major type or a minor type. Remember, it's a type of minor one. It's type of minor one. Okay, so alpha oxidation can remove alpha oxidation can remove only one carbon. Remove only how many carbons? One carbon. Alpha oxidation can remove only how many carbon atoms? One carbon atom at a time. Okay, so it can remove only how many carbon at a time? One carbon at a time. Okay, so if it can remove only one carbon at a time, so what happens? Let's try to understand. So we have a fatty acid called as phytic acid in the food. We have fatty acid called as phytic acid in the food. This phytic acid, my dear students, first it must undergo alpha oxidation. Alpha oxidation. Then it will give rise to somebody called as a phytinic acid. It will give rise to somebody called as a phytinic acid. Now this phytinic acid will undergo beta oxidation. Beta oxidation. Okay, so that will break itself into small products for the energy. Okay, I mean to say small ketone bodies. बाद में इसका स्क्रीनशॉट उठा के मुझे कोई पूछ लिया ना, मैं पकड़ के पीटूंगा. सर व्हाट इज द मीनिंग ऑफ, स्क्रीनशॉट उठा के भेजेंगे, सर व्हाट इज द मीनिंग ऑफ एक्स एक्स एक्स. अरे एक्स नहीं है वो क्रॉस कर रहा हूँ. सो बेसिकली द फैटी एसिड विल अंडरगॉन द ऑक्सीडेशन. आई एम पुटिंग ए क्रॉस और कोई स्क्रीनशॉट उठा के भेजेगा व्हाट इज द मीनिंग ऑफ एक्स एक्स एक्स. अगर कोई पूछ लिया स्क्रीनशॉट डाल के मैं पूछूंगा कि जाके गूगल कर लो. ठीक है, आई एम putting a cross. I'm just putting a cross over there. It's representing breakdown of phytic acid. So for the phytic acid to undergo the breakdown, it must undergo alpha oxidation. So if there is a defect of alpha oxidation, it will lead to accumulation of phytic acid in the body. So the accumulation of phytic acid leads to a disease called as Refsum disease. What is the name of the disease? Refsum disease. Okay, it's not Resham disease, it's not Rashmi disease, it's a Refsum disease. किसी का नाम रश्मि है तो offend मत हो जाना. I'm just making a joke. Okay, ये रेशमा भी नहीं है, offend मत होइएगा. ठीक है, so it's called as the Refsum disease. It's called as what? Refsum disease. It's called as what? Refsum disease. Okay, sir, समझ में आई बात? Okay, so this is a story of your, what is that? This is a story of your, yes, this is a story of your fatty acids, all the important key concepts of the lipids which are required for. भाई साहब ये सब मजाक में भी मत बोल देना. हम कोई लीक नहीं करते, कोई सपोर्ट नहीं करता हूँ. आई एम अगेंस्ट इट. कोई ऐसा बात ही मत करो. ओके, वी डोंट वांट दैट. हम लोग बहुत स्वाभिमान से जीते. हम लोग भैया एग्जाम पेपर बनाओ, नियत से जाके अटेंड करेंगे. ठीक है, इट्स कॉल्ड एज रेप्सम डिसीज. चलिए फिर दैट फिनिशेस योर फैट. Okay, that finishes your, what is that? Fat. Okay, so once we are done with the fat, let's go to the amino acids. So amino acids is an important chapter, but amino acids के अंदर let's cut it short into very very important key concepts जो जो हमें सीखना है उसको पढ़ते हैं और ज़्यादा जिंदगी को कॉम्प्लिकेट नहीं करते हैं. जिंदगी has to go simple. Okay, so let's start off with the amino acid. So amino acid are what? Amino acid are the building blocks for proteins. Amino acids are the building blocks for proteins. So all the amino acids combine with each other. All the amino acids combine with each other to form the proteins. Okay? To form the proteins. So if they are involved in what? A protein synthesis. They are involved in what synthesis? Protein synthesis. Let's try to understand the structure of the amino acid. अरे amino acid की structure की बात कर रहा हूँ. R, carbon atom. Okay, and you have your NH2 and you have your COOH. Okay, सर ये R होता क्या है सर? R, अरे रोना मत भैया. R stands for side chain. मतलब क्या है? हर अमीनो एसिड में meaning is very simple. Okay, meaning is very simple. So the meaning what I'm trying to tell you is R nothing but a side chain. ठीक है, R nothing but side chain. What is this side chain? मतलब in every amino acid, we will always have amino group and a COOH group. In every amino acid we will have a amino group and COOH. But हर amino acid का structure अलग होता है. So that variable part of the structure is represented by R. Okay, that variable part is represented by R. So the variable chain or a side chain is represented by alphabet R. Okay, so the functional groups are NH2 and COOH. NH2 and COOH. Okay, these amino acid at a physiologically most of the time they will remain as a Zwitter ion. They remain as a Twitter ion nahi hai. Zwitter ion. They remain as which ion? Zwitter ion. They remain as what? Zwitter ion. So Zwitter ion is the type of ion which has the नेट इलेक्ट्रिकल चार्ज 0 होता है बट उसके अंदर पॉजिटिव चार्ज भी होता है नेगेटिव चार्ज भी होता है. अब तुम्हारा दिमाग बोल रहा है कि मेरा दिमाग खराब हो गया. ऐसा कुछ दिमाग खराब नहीं हुआ. मैं दिखाता हूँ, सुनो जरा, देखो जरा. Okay, so it will remain like R and C. ठीक है सर. Okay, so COO minus and NH plus. तो पॉजिटिव वन है, पॉजिटिव आयन इज देयर. एस कन्याश नायत is this, it is here. Okay, so negative ion is there. Yes, it is present, but net charge is what? 0. Okay, that is why we call it as a Zwitter ion. So because they remain as a Zwitter ion, because of this Zwitter ion, they have a high melting point. A MCQ आ सकता है directly. Why amino acids have a high melting point? Because physiologically they remain as a Zwitter ions. They remain as what? Zwitter ions. कोई मत ये मत बोल देना, ठीक है? Twitter ion, ठीक है? एग्जामिनर दे भी देगा, तुम्हारे साथ मजाक उड़ाने के लिए दे भी देगा, ठीक है? तो उसका मतलब ये नहीं कि तुम जाके फंस जाओगे. So most of the amino acids will remain as a Zwitter ion. Okay, now the most important aspect which you need to understand is that the amino acid without any chiral carbon ऐसी कार्बन होती है. Chiral carbon is such type of carbon. It is bound to 4 different groups. कोई भी कार्बन का वैलेंसी 4 होता है. वो चारों अलग अलग चीजों से जुड़ा हुआ है. Okay, it does not have a similar ones. Okay, so it is bound to 4 different things. ऐसा कहां पे नहीं होता है. ऐसा कौन सी अमीनो एसिड है? which is that amino acid which does not have a chiral carbon? चिल्लर कार्बन नहीं है बेटा, ठीक है? It's chiral carbon. Chiral carbon means carbon being bound to the 4 different groups. The amino acid without a chiral group, chiral carbon is your glycine. Is the simplest amino acid. Okay, there is an amino acid जिसके अंदर अमोनिया ग्रुप के साथ कुछ और बॉन्ड हो. Okay, then the amino acid, the classic example we have is proline. Okay, so now let's take one amino acid, NH2, R group, CCOOH, and one more amino acid, NH2, R group, CCOOH. So we have 2 amino acids. Okay, so one amino acid binds with the another amino acid with the help of a bond called as the peptide bond. What is the name of the bond? James Bond. No, not James Bond. Peptide bond. So the peptide bond is present where? Peptide bond is present between the COOH group of one amino acid to the NH2 group of another amino acid. So ammonia group और COOH group दोनों एक साथ जुड़ जाते हैं. फिर क्या बनता है? What will be formed? Peptide bond. So ऐसा multiple amino acids if they are attached will have a protein. Understood? Okay. Now let's go to the classification. The simplest amino acid. So we have multiple ways to classify amino acid based on the structure, based on the nutritional requirement we have. So I would like to use this simple one. So we have simple amino acid. Simple ones are glycine and alanine. इनका ज़्यादा note करके नहीं होता है. Okay. Why? I will understand further. Okay. So we have branched chain amino. So branched chain amino acid: leucine, isoleucine, and valine. There are three of them: branched chain amino acid, leucine, isoleucine, and valine. Leucine, isoleucine, and valine. Sulfur containing amino acid: methionine and cysteine. Hydroxyl containing amino acid: serine and threonine. Serine and threonine. Okay. All right. We have derived amino acid. So derived amino acid के लिए we have classic example, that is proline. Okay. So which is not coded by any codon. So almost we have 20 amino acid, out of which we have 21st नया वाला. Okay. बायोलॉजी बोल दिया मैंने. ये कब हो गया? ये कब हो गया? Okay, now listen to me very carefully. So 21st amino acid which is later found one, that is selenocysteine, and 22nd amino acid which is found even later one, that is only pyrolysin. अब ये दोनों को याद रखना पड़ेगा. अब ध्यान से सुनो, ट्रैप तो यहीं पर है भैया. Okay, UGA and UAG are what? Stop codons. UGA and UAG are what? Stop codons. So if UGA and UAG are stop codons, if they are stop codons, then how are they coding for these amino acids? Yes or no? So remember, UGA and UAG code for 21st or 22nd amino acid only if insertion elements are present. Insertion elements present in a gene. अब हो गया, ये उड़ गया, ऐसा आया सर. UAG, UGA are what? Stop कोडन. अंदर तक code for 21st 22nd अंदर घुसा. Immediately I told insertion element, it took a U-turn and the information went back, bounced back, है ना. तो चलिए इसको ठीक करते हैं. Now listen to me. So we have a gene. What is a gene? A part of a DNA which codes for some protein. वो प्रोटीन को कोडिंग इंफॉर्मेशन है. इट हैज द कोडिंग. वो जीन के अंदर इफ द जीन कंटेन्स इंसर्शन एलिमेंट फॉर 21st अमीनो एसिड ओनली देन, मतलब सेलेनोसिस्टीन का इंसर्शन एलिमेंट वो जीन के अंदर प्रेजेंट होता है. इफ इट इज प्रेजेंट ओनली देन यूजीए विल कोड फॉर सेलेनोसिस्टीन, एल्स इट इज अ स्टॉप कोडन. Okay. The same thing, if insertion element for pyrolysin, if it is present in the gene, then only UAG will code for pyrolysin, else it is a stop codon. Okay, so normally they are stop codons. Okay, but if 21st amino acid insertion element is present, then it will insert the selenocysteine, that is UGA. If not, no. If pyrolysin insertion element is present, then UAG will insert pyrolysin, else no. I hope you have understood this so far. Okay. So let's go to the next aspect. The next aspect is, let's understand the overview of how our body handles the proteins. ठीक है, इसमें दूसरा इमेज पढ़ेंगे. इसको अच्छा नहीं लगा मुझे, ठीक है, इसको नहीं पढ़ते हैं. Okay, I will teach you different image. Okay, but before going to the different image, first let's try to understand how our body handles your, what is that, proteins. Okay, all right. Okay, so how our body handles the proteins. तो तुम लोग फूड के अंदर से क्या कहते हैं? फूड के अंदर से प्रोटीन्स. Okay, now proteins will go to the GIT, into the intestine. Okay, now in the intestine, under the influence of proteases, proteins will break themselves into amino acids. Okay, these amino acids will get absorbed. These absorbed amino acid go and synthesize the new protein. Synthesize the new protein. Synthesize the new protein. Synthesize what? New protein. Okay, so this new protein, whatever is there, this new protein will do its function. Followed by the function, proteins will break down. Proteins will break down. So proteins will break down. If proteins break down, very simple. Proteins are made out of what? Proteins are made out of amino acid. So protein will break down into amino acids. So now these amino acids already has done their function. Once they have done their function, these amino acid has a waste. That is because their structure is affected. Now ammonia is there, that is the waste product. This ammonia, whatever is there, this ammonia will be so where protein breakdown will occur? In the organs. Okay, in the organs such as brain, maybe in the muscles after intense physical activity. अरे physical workout जो तुम सोच रहे हो वो नहीं, सडनली जाके जिम में ज्यादा वर्कआउट कर दिया तो ब्रेकडाउन ऑफ प्रोटीन will occur. हमेशा फिजिकल एक्टिविटी बोल दिया तो बेडरूम में चले, सोच बदलो. ठीक है, anyways, now you have organs. In the organs there is a breakdown of protein. Protein will give amino. So in the brain, okay, the ammonia will be taken by your glutamate. So ammonia will be taken by your glutamate. Okay, now glutamate plus ammonia, now it will become into glutamine. It becomes into glutamine. So the transfer of ammonia from one amino acid to another amino acid such as glutamate is only called as transamination. Transamination requires which vitamin? Vitamin B6. Correlation. समझ में आई बात? Okay, now let's go to the next aspect. What is that? That is you have your ammonia waste in the muscle. Again it will be taken by glutamate, but glutamate will take the ammonia. Glutamate plus ammonia, so it is basically glutamine. Now glutamine can combine with the pyruvate. Pyruvate will give rise to alanine. Glutamate plus pyruvate will give rise to alanine. So glutamine and alanine will go to the liver. So in the liver they unload the ammonia. Now we were thinking, sir question कहाँ है? अभी बताऊंगा ना, दिखाऊंगा ना. Just wait, रुको जरा, तसल्ली रखो. Okay, so they unload the ammonia. So now this ammonia enters into urea cycle. Urea cycle will form the urea will go to urine. So the digested proteins will get eliminated in the form of the ammonia will get eliminated in the form of urea. The formation of urea cycle will occur in the liver. Question number 1, where does urea cycle take place? Liver, kidney में नहीं होता है. ठीक है, who is carrying the ammonia from the muscle to the liver? From the muscle to the liver, alanine. Question number 2, from the brain to the liver, glutamine. Okay, so glutamate, after taking ammonia it will become into glutamine. Okay, so these are the 3 questions which have been previously asked. Okay, so now here you have understood how your body handles the proteins. Meanwhile you also understood your transporters of ammonia in the body. समझ में आया? Understood? Okay, now all the ammonia in the liver combines with the carbon dioxide Okay, will give rise to carbamyl phosphate, with the help of an enzyme. Ammonia and carbon dioxide in the mitochondria of the liver combines with the help of an enzyme called as carbamyl phosphate synthase 1, CPS1. So CPS1 will give rise to a substance called as carbamyl phosphate. This carbamyl phosphate will combine with ornithine. Carbamyl phosphate and ornithine, with the help of an enzyme OTC, ornithine transcarbamylase, it will give rise to citrulline. Now, citrulline will give rise to arginosuccinate to arginine. Arginine itself is an individual amino acid. Arginine, under the influence of an enzyme, arginase will give rise to urea and ornithine. This ornithine will be reutilized. So, ornithine is being cycled again and again. Urea cycle is also called as ornithine cycle. CPS1 is the rate limiting enzyme of your urea cycle. Which amino acid responsible for urea production? Arginine. Where does urea cycle take place? Liver. Where exactly in the liver? Both cytoplasm and the mitochondria. So the starts in mitochondria, ends in cytoplasm. That is the story of your urea cycle. Ardhamainda Nayana. Okay, so that is the story of urea cycle. So urea cycle's rate limiting enzyme is carbamyl phosphate synthase 1. The next enzyme is ornithine transcarbamylase. Okay, so let's go to the next one. The next aspect. The next aspect is what? The next aspect is clinical correlation to this one. What is that? Rate limiting enzyme. Already I told you people. Carbamyl phosphate synthase 1. So CPS1. CPS1. Thank you. Thank you. Well, CPS1 and 2 are the isoenzymes, buddy. That's different. OTC is different from CPS. CPS का isoenzyme होता है CPS1, CPS2. ठीक है? Okay. Now, which amino acid is responsible for arginine? Which enzyme? Arginine. So let's talk about a disease, hyperammonemia. ये previously पूछा हुआ क्वेश्चन. ये होता है प्रीवियस ईयर टॉपिक को डिस्कस करने का तरीका. आप लोग करते क्या पता है? गलती कहाँ करते हो? मतलब when you are studying also, okay, गलती कहाँ पे होता है? इस दैट कि you are not sure what to read, my dear. ठीक है? अब what to read की बात आए ना, तो 1-2 मिनट उसके बारे में भी बात हो जाए. Okay, let me address the stage and phase you are going through. Okay, then we will come to hyperammonemia. Okay, एक साथ में दिमाग के अंदर मतलब अमोनिया नहीं भरते हैं. First let's try to solve, understand our scenario. Dear, the problem what we all of us encounter right now when you're closer to it. The question number 1 most of you get is, sir, I'm being stressed. Okay, good. You are being stressed, that means you are on the right track. Sir, I'm having a fear that what if I don't recall? Okay, question number 2. Very good. Then, sir, when all the subjects are asked together, what if my brain does not work? Question number 3. Okay. Then, sir, I have a feeling that I'm forgetting the subjects. These are few common questions. Sir, इन सबको मिला के मुझे नींद नहीं आता. Let's address them one by one and try to understand our scenario, and let's try to make a simple plan or a simple strategy or simple understanding of our reality ki hum kya go through kar rahe, so that it will be easier to handle for you. Okay, so the point here is that sir, when I'm doing one subject, I'm unable to recall another subject. Dear, when you're doing one subject and when you're trying to recall another subject is like going on a date with a girl named Lavanya, okay, and calling her, for example, Neha. ठीक है, समझ में आया बात? लावण्य के साथ डेट पे गए हो और उसका नाम बुला दिया तुमने नेहा. ठीक है, तो डेट नहीं होगा, चप्पल पड़ेंगी. ओके, यस यस, आ जाओ. नहीं नहीं, आ जाओ. ये सब तुम्हें लाइक लाइव में होगा, थोड़ा आगे पीछे करके देख लीजिएगा दिवस. ओके, क्योंकि सब लोगों को इनकन्वीनियंट. So now what happens is that you are doing one subject, studying one subject and trying to recall another subject. You're putting your brain in a situation of stressing out about both the subjects. Don't do it. So whatever the question in front of you, are thinking about that question only. Okay. So if anybody named is Lavanya and Neha, please don't get offended. I'm just kidding. Okay. Now, so the point is you think about one subject which you are doing, right? Okay. So don't overthink yourself. Sir, what if I don't recall? See, brain works like a computer. Okay. Computer के अंदर तुम सारे information dump कर दिया. Okay. But when needed, when you go and search, you'll get the answer. Okay. Like that only our brain, it will accept the information. It will give out the answer to that information after processing only if you have read, and only that particular part is being asked. Okay. So रोज तुमने morning उठ के मतलब you dress up, right? You don't think about which type of inner you are wearing until and otherwise somebody asked, but you know it. Like that only, you don't need to think about biochemistry 24/7. All you need to know is that when I ask you which amino acid is responsible for the production of vitamin B3, you should tell tryptophan. Okay, so that is how you need to keep your mind calm. So what is asked, focus on that. Okay, then the second thing, you're having a feel that you're forgetting. So you're not really forgetting, only thing is that you're overthinking. Okay. Then, sir, I'm having anxiety. What if I don't recall? Again, you got the answer for that also. Your brain works like a computer. It will recall. Okay. Then, अभी stress को कैसा handle करना है? So stress को handle करने का एक ही तरीका, accept it. तुम कितने भी attempt हो, या first attempt हो या second attempt हो, doesn't matter about the number of attempt, but the truth is very simple that you have to face the exam. So the day you accept the reality, you will have to face कोई भी attempt हो, पिछले attempt हो या यही attempt हो, or this is the first attempt, doesn't matter. You'll have to face this last 1 month. तो इस टाइम पे what you have to do is that stress तो बहुत है, but you are trying to push yourself in such a way that तुम्हारा एक routine preparation जो जा रहा है, that should not get deviated. Already you have a routine, don't let it deviate because of the stress. वो stress के साथ कि चलो जो होगा देखा जाएगा करके push करो. That's what I'll tell you. Okay. And तुम्हें stress आ रहा है, डर आ रहा है, मतलब you are preparing, that's why you're getting scared, that's also fine. But stress आ गया, because of that I will stop studying, that is the mistake. I don't want you to do that mistake of stopping studying. Okay, do not stop, keep continuing. Okay, and ज्यादा ग्रैंड टेस्ट के ऊपर मत भागना. ओके, एग्जाम तक पूरा प्रिपरेशन के दौरान थ्रू आउट द टाइम एग्जाम तक all the total number of GTs is 2 or 3 is maximum I would recommend. That's sufficient according to me. Okay, सिर्फ क्वेश्चन पे मत जाना, सिर्फ नोट्स पे भी मत जाना. तो you should have a balance. तो पहले नोट्स को पढ़ो, whatever the source you have used, then do the rapid revision of that particular subject, followed by the do the MCQs. Don't fall into the trap of thinking that मैं subject का class सुन लिया, I heard the class, so now I'll go and solve the MCQ and I should get 100%. That's not possible. Okay, that's the reality. Sir, we have last 1 month time. Is it possible to crack the exam? Yes, it is possible. Okay, only thing is that you need to put a genuine heart and do not listen to stupid people who tell that तुम लास्ट 1 महीना है, तुम्हें स्ट्रेस आ रहा है, ये आ रहा है ना, नहीं हो पाएगा, छोड़ दो. ये गधों को ना दूर रखो पहले, किक देम आउट ऑफ हु टेल्स दैट अभी लास्ट 1 महीना नहीं हो पाएगा. यार क्यों नहीं हो पाएगा भाई, पहले तैयारी तो करो. ठीक है. सो इस एग्जाम को देख के डरने से ज्यादा कि स्ट्रैटेजिकली प्रिपेयर कैसा करें भैया, दिस शुड बी द थिंग. So I will not bore you with more of philosophical things. I didn't say any philosophy, but I have told the truth how it works. Okay, तो क्योंकि आप लोगों ने क्या कर देते हो कि you start panicking. Okay, anyways, let's come back to the urea cycle. Urea cycle के अंदर क्या है सर जी? So the disorder of the urea cycle, we have type 1 hyperammonemia, where there is a deficiency of which enzyme? CPS1. Deficiency of which enzyme? CPS1. CPS1 deficiency will lead to elevated level of ammonia. Elevated level of ammonia. So CPS1 deficiency leads to hyperammonemia type 1, where there is an increase of ammonia in the blood. So increased ammonia in the blood, ammonia cannot be excreted through the kidneys, so ammonia will accumulate in the body. Ammonia is toxic to your brain. Ammonia is toxic to your brain, so the child will become confused, because it's a genetic disorder, right? From the birth itself will be there. Confusion, lethargic, confused, lethargic, and even very drowsy. Even there is a loss of consciousness can be present, and elevated level of ammonia if found. You can suspect in a newborn the hyperammonemia type 1 because of the deficiency of your, what is that, deficiency of your CPS1. So type 2 hyperammonemia, there is a deficiency of OTC. This was a previous year question. Okay, so there is a deficiency of OTC, ornithine transcarbamylase. तो क्या होता है, this enzyme ornithine transcarbamylase is absent, so carbamyl phosphate will be elevated. So what will be elevated? Increase of carbamyl phosphate. Increase of carbamyl phosphate. Okay, increase of carbamyl phosphate, it will, this carbamyl phosphate whichever is elevated, this carbamyl phosphate, elevated carbamyl phosphate will enter into an alternate pathway, creating a uric acid, so there will be formation of the uric acid. Okay, so let's go to the discussion of next amino acid, that is aromatic amino acid. We have a phenylalanine. Phenylalanine, my dear students, undergoes the hydroxylation with the help of an enzyme, phenylalanine hydroxylase. So here, with the help of some substance called as tetrahydrobiopterin. Okay, tetrahydrobiopterin OH group को डोनेट करता है, and hydroxylation करने के लिए enzyme which is helping is phenylalanine hydroxylase, which will create a amino acid called as tyrosine. This tyrosine is responsible for the production of T3 T4. Okay, it is responsible for the production of your catecholamines. Okay, it is also responsible for your what, it is responsible for your production of some substance called as melanin. So if there is a deficiency of phenylalanine hydroxylase, there is an increased level of phenylalanine, tyrosine is absent, so T3 T4 nahi banega, and catecholamines are not there, and melanin is not there. If there is no melanin, melanin is the pigment of the skin which causes a dark pigmentation. So if melanin is absent, the skin will become pale and the hair will become blonde. Wow, pale skin, blonde hair, beauty, Russian. नहीं भैया, T3 T4 भी तो नहीं बना हुआ है, so there is no proper development of the brain, so the person will also have mental retardation. So it's like a beauty without brain. So mental retardation, pale skin, mousy odor, and blonde hair are clinical features associated with the deficiency of phenylalanine hydroxylase. It's a type of which gene defect? PAH gene defect. So this, the name of the disease is called as phenylketonuria. Okay, let's talk about the formation of T3 T4. I'm not going to waste the time on step-by-step explanation of T3 T4. So basically all the iodine whatever you consume will be taken into the thyroid cell with the help of NIS, that is only called as sodium iodine synthetase. Sodium iodine synthetase will take the iodine. This iodine will be pumped into the colloid. Okay, on the other hand, so this thyroid follicular epithelium will produce a protein called as thyroid globin. Okay, so thyroid globin भी होता है. Thyroid globin के अंदर we have an amino acid called as tyrosine. This tyrosine and iodine will combine to give rise to monoiodotyrosine, diiodotyrosine, T3 T4. All of their formation require an enzyme, TPO is required. Okay, so what is TPO? That is only thyroid peroxidase. Thyroid peroxidase is required. It is responsible for the production of melanin. It is responsible for the production of T3 and T4. So T3 T4 synthesis requires an enzyme. The name of the enzyme is TPO, thyroid peroxidase. So thyroid peroxidase is inhibited by the drugs such as carbimazole, methimazole, and propylthiouracil. Okay, so we have one more product from the tyrosine, that is your melanin. Melanin is produced by melanocyte. So in the melanocyte, what happens? You have an amino acid called as tyrosine. So this tyrosine amino acid will get converted into melanin. Okay, so with the help of an enzyme, the name of the enzyme is called as tyrosinase. The name of the enzyme is called as tyrosinase. This tyrosinase is stimulated by some substance. What is that called as? Melanocyte stimulating hormone. Melanocyte stimulating hormone will stimulate the activity of tyrosinase, which will break the tyrosine into melanin. So melanin is produced by melanocytes. Melanocytes are derived from embryologically, they are derived from the neural crust cells. Neural crust cell. So neural crust cells से other derivatives that is only C cells. C cells मतलब thyroid gland में होता है, parafollicular cells, ठीक है, and your adrenal medulla, melanocytes and your C cell, all of them are derived from your neural crust cells. Okay, all right. So deficiency of tyrosinase leads to albinism, means in which complete body is having depigmentation, and vitiligo is having a patchy depigmentation. Patchy depigmentation. Okay, hypopigmentation नहीं बोलना चाहिए, depigmentation बोलना चाहिए. Patchy depigmentation. So the patchy depigmentation is seen with what? Patchy depigmentation is seen with vitiligo. Complete body depigmentation is seen with albinism. So this is a story of your, what is that? This is a story of your yes, that is your what? That is your albinism and vitiligo. Okay, so once we understood about that, let's go to the next aspect. The next aspect is about your, what is that? That is only your catecholamine synthesis. The synthesis of catecholamine, so please understand, synthesis of catecholamine occurs in two places. One is adrenal medulla, and one more place, my dear students, that is only one neurons. Which neurons? Sympathetic neurons, and also in the central nervous system. Okay, so the amino acid tyrosine, under the influence of tyrosine hydroxylase, means addition of a OH group, it will give rise to dihydroxyphenylalanine, which is DOPA. DOPA under the influence of an enzyme, DOPA decarboxylase. This is a very important enzyme in understanding of a disease. Which is the disease? Parkinson disease drugs. The drugs used in the Parkinson disease is a very important thing to understand. Dihydroxyphenylalanine will get converted into dopamine. Dopamine will get converted into noradrenaline. Noradrenaline will get converted into adrenaline. So dopamine, noradrenaline and adrenaline are your, what is that? Are your catecholamines. Okay, so adrenaline will break down into metanephrine, noradrenaline will break down into normetanephrine. So metanephrines are increased in which disease? Yes, of course, in your pheochromocytoma. So in which we are going to look at, what is it? We are going to look at a elevated level of 24-hour urine metanephrines. So 24-hour urine metanephrines. Okay, so that is a story of your, what is that? That is a story of your, yes, of course, that is your synthesis of catecholamines. Okay, so once we understood, so this phenylalanine destruction is not much important. Sorry, tyrosine destruction is not much important as of now. Let's go to the next one, that is only your collagen. Directly, let's go to the collagen. But before going to the collagen, I would like to discuss about your sulfur containing amino acid metabolism. Okay, so all of you know there was one substance called as noradrenaline. Noradrenaline was getting converted into adrenaline. Okay, so ये conversion होने के लिए क्या होना चाहिए था? What was required? Required one was methyl. Required one was methyl. So the process name was called as methylation. What is the name? Methylation. Okay, so for the methylation we require a methyl. Methyl group तो ऐसे ही नहीं आएगा ना. There should be somebody who donates the methyl. So who is that somebody which donates the methyl group? That is only done by S-adenosyl methionine. S-adenosyl methionine. This S-adenosyl methionine will donate the methyl group and it will become into S-adenosyl homocysteine. So homocysteine and methionine, what is the difference between these two? Adenosyl group is same. So difference between the methionine. So methionine के अंदर से एक methyl group को हटा के किसी और को donate कर दिए. You have removed methyl group and gave it to some. So methionine से methyl group को remove करोगे तो homocysteine. So methionine say if you remove a methyl group, we are going to get what is that? Homocysteine. Okay, we are going to get what is that? Homocysteine. So this S-adenosyl homocysteine further gets converted into homocysteine. Okay, this homocysteine will further get converted into methionine. So if you want to convert back into methionine, you should add what is that? Methyl group. There should be someone who donates the methyl group. Who is that who is donating the methyl group in this scenario? That is only methyl tetrahydrofolate. Methyl tetrahydrofolate. So methyl tetrahydrofolate will donate the methyl group with the help of an enzyme called as methyl transferase. Guys, just 1 second. Just 1 second. There's some disturbance coming. Let me look at it. Okay, guys, I'm sorry. There was some issue. Okay, we sorted it. Anyways, there was a disturbance. That's it. Okay. Okay, let's continue. I'm sorry. आगे आगे सब कुछ आ जाएगा भैया. Tension मत लो. Everything will come back. Just don't worry. Okay, so homocysteine gets converted back into methionine with the help of transfer of methyl. So for that methyl group donor will be what? Methyl tetrahydrofolate. So we require an enzyme. What is the name of the enzyme? Methyl transferase. So this methyl transferase to work, we require a vitamin B12. Okay, so this methionine will come back into SAM and this the reaction goes on and on and on. Okay, so if there is no B12, transferase will not work. So no methyl transferation, homocysteine will be inhibited. So increase of homocysteine seen with the B9 and B12 both of them. What? Deficiency. Okay, but increase of homocysteine and increase of methyl malanoic acid is seen in, yes, of course, is seen only and only in B12 deficiency. Is seen only and only in B12 deficiency. B12 deficiency. So B12 deficiency. So now here I need you to understand B12 deficiency. Okay. So here I need you to understand one important concept. What is that? So elevated level of both homocysteine and methyl malanoic acid seen in B12 deficiency. Only and only, sorry, both are elevated in only B12. Okay. But only homocysteine will be elevated in both of their deficiencies. Okay. So this is very commonly asked previous year. This very commonly asked previous year question. Okay, so that is the story of your what is that important concepts of amino acid. Then let's talk about a amino acid with the high buffer capacity. High buffer capacity. Buffer capacity. Okay, that is your histidine. That's your histidine. That is your histidine. Okay, so there are other key points which you need to remember. Okay, so you have a what is that? We have something called as creatinine. What is that? Creatinine. Creatinine is a type of tripeptide. Creatinine is a type of tripeptide which is made out of three amino acid. Which is made out of three amino acid. Okay, so one is your glycine. One is your glycine. Okay, one is your what is that? Alanine. Alanine, and one more amino acid is your methionine. Methionine. What is that? Methionine. Creatinine is a tripeptide. Okay. So example other example for the tripeptide, you have your glutathione. You have your glutathione. Glutathione is also a type of tripeptide. Glutathione is also a tripeptide. Also a tripeptide, which is what? which is an antioxidant. Okay, antioxidant prevents aging. So ये सब तो तुम cosmetic approach में चले जाते. First of all, glutathione का role in the body, it's a intracellular antioxidant of red blood cell. पहले तो ये समझो. Okay, so that is very important. It is also an antioxidant which also works in the liver. उसके बाद में आते हैं cosmetic के uses में. So that is the story of your glutathione. Okay, so let's talk about the structural protein, that is about collagen. Okay, so type 1 collagen is located in the ligaments, bone, dermis and tendon. Type 1 collagen defect will lead to a genetic defect, will lead to a disease called as osteogenesis imperfecta, where there is a fracture of the bones can be seen, multiple fracture of the bones. There will be blue sclera. Okay, and there is a deformity. What is that? Congenital talipes equinus varus deformity. CTEV deformity can be seen in these people. Okay, then you have type 2 collagen. Type 2 collagen is present in the cartilages. Defect will lead to chondral dysplasia. Type 3 collagen defect will lead to present in the aorta. Defect will lead to Ehlers-Danlos syndrome. Okay, type 4 collagen defect will lead to Alport syndrome. Alport syndrome will lead to the defects like anterior lenticonus, sensory neuronal hearing loss, glomerulonephritis, and if you take a renal biopsy, so you can find a basket wave appearance. This Alport syndrome is a X-linked inherited, both recessive and dominant are seen, but predominantly X-linked recessive type of inheritance is seen. So the disease name is Alport syndrome, in which what is there? The defect of the basement membrane. Defect of the basement membrane. It is a non-immunological glomerulonephritis, you can say. Immune system involved हुए बिना, without immune system being involved, there is a glomerulonephritis, that is nephrotic or nephritic syndrome can be seen. And Ehlers-Danlos syndrome, high flexibility. Okay, तो स्किन को स्ट्रेच करेंगे ये लोग, they can bend their joint excessively, and also they can have aortic dissection. Aortic dissection is possible. Okay, so this is a story of your discussion of all the important key concept. And अब आगे बढ़ते हैं. Now I would like to discuss with you people not the carbohydrate but all the important aspects of carbohydrate related, the enzyme deficiencies and the disorders. So let's quickly go through that, dear. Okay, pyruvate kinase. Pyruvate kinase is the last enzyme. I will tell about the enzyme. You can find in your mail. Pyruvate kinase is the last enzyme in the glycolysis. Okay, so pyruvate kinase, phospho in the glycolysis, phosphoenol pyruvate to pyruvate conversion require your pyruvate kinase. During this time, there is a 2 pyruvate, phosphoenol pyruvate will get converted into 2 pyruvates. So during this time, there are 2 ATPs which are being produced. Okay, so pyruvate kinase, if there is defective, if it is defective, it will lead to hemolytic anemia. It will lead to hemolytic anemia. Okay, then fructokinase deficiency. Fructokinase deficiency is a, so in the fructose metabolism, you have fructose. Fructose will get converted into fructose 6 phosphate, fructose 6 phosphate to fructose 1,6 bisphosphate. So this fructose 1,6 bisphosphate under the influence of aldolase B, it will get converted into what is that? GLAP. ओके, जीएपी नहीं है भाई, गैप नहीं है, ये गैप कप ऐसा कुछ मत बोलना. जीएलएपी ग्लिसरॉल्डिहाइड फॉस्फेट एंड डीएचएपी डाइहाइड्रोक्सी एसीटोन फॉस्फेट, एंड फ्रॉम हियर 1,6 बिस्फॉस्फेट से सेम एज ग्लाइकोलाइसिस. सो अगर यहाँ पे एंजाइम आता है फ्रक्टोकाइनेस, सो फ्रक्टोकाइनेस डेफिशिएंसी लीड्स टू एसेंशियल फ्रक्टोजुरिया. एसेंशियल फ्रक्टोजुरिया. Okay, aldolase B deficiency leads to what is that? So this is the enzyme aldolase B. So aldolase B अगर defect होगा तो it will affect both affect glucose as well as fructose metabolism. Glucose as well as fructose metabolism. It will lead to a disorder called as a hereditary fructose intolerance. Fructose intolerance. So this is a condition where what will be there? There will be what is that? Hypoglycemia immediately after the feeding. Okay. Hello, sir. Will this be enough for FMG? See dear, this is a good question. I am not a person of fake promises. I can guarantee one thing. Most of the questions will be from these keywords. There's no doubt about it. Okay. But I will not tell that 100% questions will come from. I have a guesswork based upon what we have seen since the past few years. Based on that, I have curated the material. Okay. I can guarantee you up to 80%. I will not guarantee you 90, 100%. 80% and above guaranteed. So just 1 second, guys. My phone is going to get off. I will connect the charger. रुको ऐसे रुको कहीं मत भागना अभी है. Many people will have a doubt. So why didn't you keep your phone for charging in the beginning? भैया मैंने इतना लाइव करते करते ना कभी भूल जाते हैं यार क्लासेस करते छोटे छोटे गलती हो जाता है. Okay, let's continue. So aldolase B. I hope I have answered your answer. Okay, so it will lead to UDP galactose, galactose and glucose phosphate uridyl transferase deficiency leads to galactosemia. Galactosemia is a condition in which there is a defect of galactose metabolism in which galactose accumulates and enters into the alternate pathway which will lead to the formation of one specific cataract to this disease called as the oil drop cataract can be seen here. Oil drop cataract can be seen. Okay. So glucose 6 phosphatase deficiency will lead to 1-Gerex disease. 1-Gerex disease. Okay. Acid maltase deficiency leads to Pompey's disease. Pompey's disease. Okay. Debranching enzyme deficiency leads to Cory's disease. Okay. Branching enzyme deficiency leads to Anderson. So remember debranching and Cory's. Remember it with the alphabet CD. Okay. So branching enzyme deficiency Anderson. Remember it as Anderson caused by branching deficiency AB. Okay. So glycogen phosphorylase defect in the liver, or you can liver also called as hepatic. We can call it as a hepatic. Will lead to Hirsch disease. Will lead to Hirsch disease. Okay. So this is a glycogen storage disorder in which there is a hepatic glycogen phosphorylase will lead to Hirsch disease. Then we have glycogen phosphorylase in the muscle will lead to a disease called as a McArdle's disease. Okay, so M for muscle, M for McArdle's. So in which what will be there? Glycogen storage disorder. So 1-Gerex to PFK till here. Okay, so what is this? Glucose 6 phosphate से लेके PFK तक type 1, 2, 3, 4, 5, 6, 7 glycogen storage diseases. Okay, so PFK deficiency leads to Tarui disease. Lead to Tarui disease. Lead to what? Tarui. G6PD deficiency leads to hemolytic anemia. Hemolytic anemia, in which you are going to find two important findings. What are those two findings, dear? The two important findings is your Haines bodies. What is this Haines bodies? Haines bodies are also called as lipid peroxide bodies. Haines bodies are which one? Lipid peroxide bodies. They are your what? Lipid peroxide bodies. Okay, phenylalanine hydroxylase deficiency leads to phenylketonuria. CPS1 leads to type 1 hyperammonemia. Okay, hyperammonemia. Okay, very good. Okay, so I'm really sorry. Let me complete this. So hemolytic anemia in that Haines bodies, and also you're going to find bite cells, not the bite marks. Okay, जो तुम सोच रहे हो ना bite marks वो नहीं है. ठीक है. हाँ, यहाँ पे सेल्स क्या होता है, बाइट सेल्स होता है, आरबीसी का सेल्स सेल्स होते हैं, बाइट सेल्स हैं। ठीक है, मैं फ्लो में आगे चला गया था, आई एम सॉरी, आई मिस द बाइट सेल। ओके, एनीवेज OTC deficiency leads to type 2 hyperammonemia. Homogentisate oxidase deficiency leads to a disease called as alkaptonuria. Will lead to a disease called as alkaptonuria. So alkaptonuria के अंदर what will happen? Urine turn black. Urine turn black on exposure to air. On exposure to air. So basically, what will be there? डार्क यूरिन ऑन स्टैंडिंग, मतलब यूरिन का सैंपल को कलेक्ट करके ऐसे ही साइड पे रखती है। यू कलेक्टेड द यूरिन सैंपल, यू हैव केप्ट टू योर साइड, देन यू आर गोइंग टू गेट ए urine color turning into black because of the oxidation called as dark urine on exposure to air. And also the person is going to have ochronosis. Okay, it's ochronosis. Okay, the meaning matiradi. Okay, it's ochronosis. Okay, so the next important aspect of alkaptonuria, so there will be ochronosis and also the person can develop arthritis. Okay, urine smell will become like what is that? The urine smell, sorry, urine smell to happening. So mainly three clinical feature. Tyrosinase deficiency leads to albinism. Okay, BCKD deficiency leads to MSUD. Here, burnt sugar smell. Burnt sugar smell. The urine color looks like a maple syrup. Urine का taste नहीं है, ठीक है? Sir, urine का taste maple syrup में होगा क्या? नहीं. Okay. So MSUD, urine looks like a maple syrup. Urine. Okay. Beta glucocerebrosidase deficiency leads to Gaucher. Alpha galactocerebrosidase deficiency leads to, what is that? Fabry's. Okay. Then beta galactocerebrosidase deficiency leads to what? Leads to beta galactocerebrosidase deficiency leads to your Krabbe's. Exosaminidase alpha Tay-Sachs. Then Sandhoff. Already I have discussed this. Okay. So that's why I'm going fast. Okay. Sphingomyelinase will lead to Niemann-Pick's. Okay. Ceruloplasmin deficiency leads to Wilson's disease. HGPRT deficiency leads to, yes, this is a very interesting disease. HGPRT deficiency leads to what? HGPRT. Hypoxanthine guanine phosphoribosyl transferase deficiency leads to what? Remember, it will lead to Lesch-Nyhan syndrome. Lesch-Nyhan syndrome. It will lead to which syndrome? Lesch-Nyhan syndrome. It will lead to which syndrome? Lesch-Nyhan syndrome. Okay. So Lesch-Nyhan syndrome is a condition where there is an increased level of uric acid. Okay. Then the patient will have agitation. Patient will also have aggressive. Patient is aggressive. The child is very aggressive, and most importantly, damaging to themselves, called as self-mutilation. Self-mutilation. Self-mutilation means biting their own lips, biting their fingernails off, this kind of problems. Okay. Then let's talk about your, what is that? That is only your very important, some poisons versus biochemical concept of it. So carbon monoxide will cause hypoxic hypoxia or anemic hypoxia. Carbon monoxide causes anemic and also tissue hypoxia. Both. Okay, it will cause both anemic and tissue hypoxia. Okay, so carbon monoxide poisoning treatment will be hyperbaric O2. Okay, then cyanide will block a complex 4 complex 4 of the electron transport chain. The name of the enzyme is cytochrome oxidase. Cytochrome oxidase is the name of the enzyme. That is only a complex number 4. Okay. Barbiturates and rotenone will inhibit the complex number 1 of the electron transport chain. The complex 1 of the electron transport chain is your, yes, NADH dehydrogenase. Malonate will block complex number 2, which is FADH dehydrogenase. Okay. Then we have warfarin. Warfarin will inhibit vitamin K epoxidoreductase. Vitamin K epoxidoreductase. अब तुम्हें समझ में आ रहा है इतने सारे मैं एक जगह पे क्यों डाला हूं? सारे के सारे MCQs है. Okay. Amanita phalloids inhibit an enzyme RNA polymerase. Okay, it will decrease the protein synthesis. And most importantly, need to remember what is the decrease the protein synthesis, and it will lead to a late mushroom poisoning. Okay, early mushroom poisoning hota hai Amanita muscaria se. There the antidote is atropine. Amanita phalloids agar atropine doge tum fail jaoge, क्योंकि atropine is not useful in Amanita phalloids. ओके अगर अमीनिटा फेलाइट्स के अंदर तुम एट्रोपिन दिया, फेलाइट्स तुम्हें फेल देगा. ठीक है, क्यों? फेलाइट्स इज द वन व्हिच कॉज लेट मशरूम पॉइजनिंग, where what is there, where there's a decrease of protein synthesis. Okay, नहीं तो तुम्हें फैला देगा ये. Be very careful. Isoniazid inhibit vitamin B6 utilization. Methanol will cause permanent blindness because it will form formic acid. So formic acid will lead to what? Will lead to permanent blindness. Okay. So few years back, maybe 2 to 3 years back, I'm not sure about which year, in Tamil Nadu there was an incident of adulteration of alcohol, because of which there were around 80 people died. Around 80, I'm not exactly sure about the number. Fluoride inhibit an enzyme in glycolysis called as inolase. भैया अगर कुछ नहीं है ना, ये 2-4 पेजों में, मतलब क्लैरिटी के साथ, if you have a clarity along with these 2-3 pages, right? So you can, I'll not tell all the question, but most of the enzyme deficiencies का आंसर देने के लिए यूज करेगा. ठीक है, बट इट इज ए डायरेक्ट क्वेश्चन आएगा. बट आज के टाइम पे डायरेक्ट नहीं आता. अगर डायरेक्ट आता तो मैं 3 पेज में रख के खत्म कर देता. You would have finished in the 3 pages if the questions were there. So concept oriented. But if you get lucky and if they ask the one liner directly, so most of it can be covered, which are basics here. Okay. Vitamin K antidote is warfarin. Warfarin ka antidote is vitamin K. Okay. So this is the story of your, what is that? Story of your all the important previous year topics and important MCQ which have been previously and commonly asked. I have covered all of them. So enjoy and डरो मत, stay confident. अगर आपको जो भी डिफिकल्टीज आता है हमारा ग्रुप में डाल दीजिए, Meduhub FMGE ग्रुप में. put down your doubts, or you can contact us also if you have any doubts or something. I'll drop my number. But for the notes, I cannot sit and send everyone individually. So go to our Telegram group. There you are going to find the notes. Okay, within next 1 hour I will share the notes here. Within next 1 hour it will be available for you people over the Telegram group. उसके लिए मुझे personally message मत करो. Okay, though I have given my number. Thank you so much. So though I have given my number, मुझे ये नोट PDF के लिए मत करो. But if you have any difficulty while studying, if you have fear, तुम्हें डर आता है, तो उसके लिए हम हैं. We are here. You are not alone. Even I am an FMG. I have completed my PG. I'm working as senior resident also. Okay. So, whole life is just a difficult part of the journey. Okay. So, वहाँ से यहाँ पे आने के लिए just you'll have to push through. थोड़ा confident रहो. थोड़ा बात है कि थोड़ा resilient बनो. जो हम लोगों ने यार एक चीज मैं हमेशा बोलता हूँ, I tell this to every foreign graduate out there, right? तो यार मतलब हमें डॉक्टर बनना था, सो फॉर एग्जाम्पल ना, रिसेंटली नीट का पेपर लीक कर, भाई हमसे नहीं हो पा रहा था ऐसे इंसिडेंट, नीट के पेपर लीक हो रहा था, ये मतलब कोई कैटेगरी के वजह से हमें नहीं मिल रहा था, कुछ तो था, वी टुक ए चांस, वी वेंट अब्रॉड. पॉइंट नंबर वन, लेट्स नॉट ब्लेम द सिस्टम, बट हम लोगों ने गए. When we left India and we went out for studying, we were merely 17 and 18 years of age, and we left the home country and we went to a different country where we didn't know the language, place, people, anything. वो सब आराम से हमने झेल लिया. We have gone through so many incidents. I know, भैया मैं भी ऐसे ही कलाकार इंसान था और हूँ. ठीक है, हम क्या क्या कांड करते मुझे पता है. I know. Okay, what and all we face and come out. Okay. So we survive a lot of pain, we endure a lot of difficulties and we come back. Now is the point, वो सबको आंसर देने का टाइम है, अभी डरने का नहीं है. It's not the time to be scared, it's the time to bloody give a 100% genuine effort. जो होगा देखा जाएगा. ठीक है, कोई डरो मत. ओके, कभी भी तुम्हें लो लगता है, कंफ्यूज्ड, तुम्हें घबराहट आता है, ऐसा कुछ आता है, हमें कम्युनिकेट करो, वी ट्राई टू हेल्प यू आउट. ठीक है, आप अकेले नहीं हो, हम लोग हैं, वी आर हियर. ओके, स्टे कॉन्फिडेंट, मेक श्योर थोड़ा हेल्थ के ऊपर भी ध्यान दो इस लास्ट 25-26 डेज ऑफ दिस टाइम, बिकॉज इस टाइम पे छोटा सा एक दिन का तबीयत खराब भी इट कैन बिकम मेंटली टॉर्चर फॉर यू. ठीक है, हेल्थ के ऊपर भी ध्यान देना. अब इसका मतलब ये नहीं कि सर आज से मैं जिम ज्वाइन करूंगा, ये करूंगा, वो करूंगा, ऐसा नहीं है. हेल्दी फूड खाओ, दिमाग को ठंडा रखो, बाबू सोना कम करो. क्लियरली योर फोकस शुड बी ऑन द एग्जाम, नॉट ऑन बाबू सोना. ओके, डोंट वेस्ट योर टाइम ऑन द love life or anything. Just this 25 to 26 days, hopefully your partner should understand. अगर समझते नहीं है तो भैया कुछ नहीं कर सकते हो, छोड़ दो, कोई दिक्कत नहीं. लड़ लेना, उसको बोल देना कि एक महीने के बाद लड़ाई कर लेंगे, आप चुप रहना. ओके, बाद में जाके संभाल लेना. ठीक है, कोई गिफ्ट देके पठा देना. ओके, now that's one thing. Second thing is that do not waste your time. Keep one focused preparation, constant preparation, keep it going. कोई भी रीजन की वजह से स्टॉप मत करना. Okay, so that's the story for today. So this will be my number. Okay, so that's the discussion of your important. It is available 7993497602. 07 नहीं है भैया, 02 है, 2. Okay, it's 2. Okay, WhatsApp is available everywhere, it will be available in the same number. थैंक यू सो मच. हमारा मीडियाहब पेज को भी फॉलो कर लो, गेट योर मतलब रेगुलरली अपडेट्स आता ही रहेगा. ठीक है, सो सारे फैकल्टी के साथ जुड़े रहिएगा. एंड प्लीज डू ज्वाइन द टेलीग्राम ग्रुप फॉर योर ओन बेनिफिट ओनली. ओके, चलिए फिर, थैंक यू सो मच. बाय बाय, गुड नाइट, शुभ रात्रि, दोब्रे नोचे, दस्विदानिया. बाय बाय, మంచిగా చదువుకోండి, నల్ల పడింగా ಚೆನ್ನಾಗಿ ಓದ್ಕೊಳ್ರಿ. ಓಕೆ, अच्छे से पढ़ लो. हरशो, ऑल गुड, बाय बाय, थैंक यू.